We're almost there. Thanks for your patience, everybody.
Thank you. And feel free to open a window.
Yeah.
Okay, you're good, Nancy. You're streaming.
Okay,
Okay,
we're
fine.
good.
Okay.
Thank you.
Okay, welcome to the May 13th Health, Social, Educational, Environmental Committee meeting. Could you all please rise for the pledge? Legislator Admisio, could you please lead us in the pledge?
I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. Could I have the roll call, please, Mary?
Legislator Adamisio.
Present.
Legislator Russo.
Present.
Chairwoman Montgomery.
Here. Just a quick announcement. We are pretty crowded tonight. We do have exits there, fire exits there and there. This is the legislative room, but the door will open and there's actually a stairwell that goes out beyond there. I'll leave through the floor in the hole there where the former legislators put me. So welcome. First on the agenda, we have item number 3, which is a discussion and approval for a resolution in support for Harriet Tubman Underground Railroad Byway. And we did have a presentation by Sage Hamilton-Hazarika of the Harriet Tubman Byway organization, but I don't think he's here. So I'm the second here, I guess. I'll take it. So the Harriet Tubman Underground Railroad Byway, Phase 1 and 2, is being proposed, and we're being asked to pass a resolution in support of that. The legislators on this committee have had the information for a few weeks now, and we're all aware of it. 65 municipalities in 8 counties have already passed the resolution in support of Phase 1. 79 of the 14 counties have passed resolutions in support of Phase 2. Basically, I'm not going to read the whole resolution unless anyone from the committee wants me to. It's a vehicle for education, preservation, and economic growth. The Harriet Tubman Underground Railroad New York Byway fosters community pride. It'll enhance residents' quality of life, preserves its historic and natural assets, inspires visitors to be agents of change, and elevates the authentic stories of freedom seekers on their journey to freedom by providing exceptional and inclusive experiences along its eventual border-to-border route. Where is it proposed? Phase 1 spans 137.17 miles with 22 documented resources demonstrating the significance of Harriet Tubman and the Underground Railroad in New York. A segment 3.37 miles in Auburn, New York, Harriet Tubman's chosen hometown, and a segment traversing 169.8 miles through Seneca, Ontario, Wayne, Monroe, Orleans, Erie, and Niagara counties. So again, we've got a full agenda. I know that my folks on the committee here are very familiar with it, and I'd like to take their comments at this time.
Yeah, I would just like to say we have 79 municipalities in 14 counties have passed resolutions to support Phase 2, border-to-border byway. That's amazing.
We're last.
Yeah, I know. But if everyone looks at the map, it's just really, it is from Auburn all the way down, Ossining, Tarrytown. Yeah, so I think this is great.
Why designate the byway? It recognizes and preserves historic significance, economic development, community pride, promotes tourism in New York, and celebrates New York's unique cultural heritage. Any comments from Legislator Russo?
No, I just think this is a great idea, and I support it.
Great, thank you. Anyone from the Legislature? Comments? Being no further comments, any comments from the public? Being no further comments, I'd like to make a motion to pass the resolution as is. Can I have a second?
Second.
All in favor?
Aye.
Thank you. Okay, item number 4, we have a discussion addressing food insecurity in Putnam County. Putnam County agencies and community partners and local food pantries are here for this healthy discussion. I intended this discussion to focus on the current state of food insecurity in Putnam County and to hear directly from organizations doing this work every single day. As many of you know, recent federal programmatic changes, including the suspension of Meals on Main Street program in portions of Putnam County, have raised serious concerns about food access. most particularly for seniors, families, and residents with limited transportation. While at the same time, it wasn't a Putnam County program, but Putnam County did allocate emergency funding last year to address food insecurity, and I've requested specific information regarding that from the county executive. That funding went to the United Way, CAP, and Cornell Cooperative, and was supposed to be dispersed to our local food pantries. And CAP, not CAP. Do I have the wrong organization that it went to? Hold on.
You were selected, but those funds were never released because the government reopened.
Okay. Those were the questions I presented to the county executive. You can see the memos in the backup of the agenda. I mean, it's online. I can read the memos that I've sent looking for clarification on that, and obviously I still don't have the clarification on that. So with that, my goal tonight is to listen, gather information, identify gaps, and better understand how county government can support the incredible work already happening throughout Putnam. I want to acknowledge that many of the people in this room are volunteers of small organizations operating under tremendous strain, and we appreciate your work and the compassion you bring to our communities every day. And tonight specifically, I would like to hear about, and obviously the legislators may want to hear different things, but I'm particularly interested in where the greatest unmet needs currently exist, populations that may be underserved, transportation or geographic barriers, coordination between organizations, and where county support could be most effective. So because we have so many organizations here tonight, I really thank you. When I started this, I realized, oh my gosh, what have I done? Invited every food pantry in Putnam County and every organization that addresses this in some way or another, whether it's our Office of Senior Resources, our Commissioner of Social Services, and all the organizations, and Putnam CAP, and every town has a food pantry or two, and our health department. We have volunteer organizations that feed thousands through just their own efforts and never asking for a dime from government. So we all are trying here to play a part, and I realized in this county, I think someone said to me a while ago, we have I forget the way they put it, but it was so profound. We have a health department, we have a transportation department, we have no food department. And I think we're living in a world right now where that's very much needed. So I always appreciate those things being brought to me by my constituents. This literally came from a constituent in the room, as most of my work does. So with that, I'd like to first ask the Department of Social Services Commissioner Sarah Servadio for just a brief overview of the current landscape and any known impacts or challenges that you're seeing. This is Sarah Servadio. She's our Commissioner of Social Services.
Hi, everybody.
Take it away.
We have such a full room tonight,
I know.
so thank you for bringing us all together. I think, like you stated, there's no identified office or employee in Putnam County to kind of oversee this. So each of the departments are doing their best, so this is great that we're all coming together. On the social services side, the issues brought to our attention are going to be different than what's brought to other departments' attention. So this is just what we're hearing through my department. For our individuals on the western side of the county, they feel that their resources are difficult to get to. There's a transportation issue over there, and they feel like they are often relying on staff in my office to assist them with that. The increase in grocery prices far outpaced any increase in SNAP benefits. And to stick with the SNAP benefits, our senior and disabled residents often get denied SNAP benefits because of excess income, or they get the minimum in SNAP, so that would be $24 a month because of their income, and that would be Social Security and or their pension. So we really try to fill the gap. As people are calling or coming in, we do have a small food pantry. We, of course, are referring them to all of our provider agencies in this room. We frequently get donations from constituents for grocery store gift cards, and those have been extremely helpful, especially over the past 12 or 14 months for us. So that's what we're seeing in the Social Services Department.
Thank you. I think before we open it up, if you're okay for any questions, I'd like to start bringing in the food pantry and providers. And with that, you know, think about questions. I did email everybody, but what changes are you seeing? What are you struggling to reach? Who are you struggling to reach? What demand increases have you experienced? What are your operational challenges, and what support do you think would make the biggest impact? And with that, I did hear from a few folks that responded that they would be attending and would like to speak. And I think first to respond was Martha Elder from Second Chance Foods, if you're okay with coming up. And if I don't mention your name and you want to speak, you know, as time allows, like, it is a full house and there's a lot on the agenda, but we're going to try really hard maybe to limit this whole thing to about 45 minutes, but we'll see how it goes. Take it away.
Good evening.
This is Martha from Second Chance
Yes,
Foods.
Martha Elder from Second Chance Foods and also a resident of the town of Kent. Yeah, so I think the biggest issue pretty much always in food access is access. You know, we live in a very rural county with kind of limited transportation options, and so transportation is one of the big barriers. I know Sarah was just referring to that on the western side of the county, but I think it exists all over the county. You know, one of our programs, our community supported nutrition boxes, does distribute probably about a third of those boxes are delivered by the church volunteers to people's homes, because there are a lot of, they're homebound or people just who don't have transportation. I also think of access in terms of, if you're familiar with ALICE data, which tells us how much a family of four actually needs to make to live in Putnam County, kind of relative to like these means testing to access certain programs. There's a really big gap. That's why Second Chance Foods, puts freezers in places like libraries and the senior centers, so that really anybody can access those meals, no questions asked, no paperwork. Again, just to really increase access. Because we don't directly serve people, we work with all the food pantries in Putnam County, as well as, our own bountiful meals freezers that we do with Cornell Cooperative Extension. I don't directly see need increasing or decreasing or staying the same. I just know that our freezers do empty, that people really do need this food. And they need it, again, to be accessible. I know people are really feeling the loss of the Meals on Main Street truck. People became reliant on that schedule when it was going around. So I think, that's a direction we need to be going in as a county. I'm a little bit confused because I thought there was like 150,000, just a contingency line for food security this year in Putnam County.
Yes.
So I just would love clarity on how do you apply for that money? What's that whole process? I'm sure a lot of people in this room would love to understand it.
And if I may, through my committee, defer to Legislator Chairman Byrne, whose initiative it was to set the money aside, and that's part of the reason why we're here also.
Yeah.
Knowing that's a drop in the bucket for what we realized the loss of the 1.4 million for Meals on Main was.
Thank you, Madam Chair, through the chair. That's a very good question, and it's a very practical question. Thankfully, this $150,000 is not in contingency. It's actually a line in our budget, the 2026 budget. So the money's already been appropriated. Mechanically, I'm going to defer to our legislative counsel, but the way we generally handle, we would consider the food pantries and other organizations that we would partner with respect to this as helping to fulfill a county mandate. One of our county purposes, certainly we have senior nutrition centers, but we also have other purposes for meals for folks who aren't seniors as well. So I would imagine, much like we do with our outside agencies, whether it's Cornell Cooperative Extension, whether I think we had a contract with Second Chance Foods and others, we would create, at least this is the way I'm envisioning it, create contracts with those outside agencies to help the county in its mission to serve a need that the county has, and that the county government is responsible for. So mechanically, I would imagine there would be contracts between the county government, and just like we have a contract with Second Chance Foods, we would have it with ABC Food Pantry and with whatever other food service truck we would have, or food service agency we would contract with. And now, as the chair said, it's only $150,000, and that's probably well below the need and you guys would know better than I certainly, but I'm guessing that's probably well below the need that's out there. So, you know, but that's what we have now. And I can't speak to the 27 budget. We're going to be getting a budget document from the county exec probably in the beginning of October. We'll see if there's anything in there. If not, certainly that's not the last step. This legislature takes the budget from there, and just as we did last year, we made this a legislative initiative. But we should just talk about, your question just had to do with now. That's how I envision it going, and I'll turn it back to the chair.
Yeah, if I can answer that also, you know, the $150,000 that was put in the 2026 budget, but there was also this outlying $150,000 that was put in the 2025 budget around the time when we were in the SNAP crisis. So, and a couple of memos addressed to the county executive asking for exactly how that money was distributed and access to participation, and can we start getting those contracts going with the food pantries so that we have a mechanism to fund them directly. And the county executive did respond. You know, one of the contracted agency, United Way, and affiliated food pantries with the United Way, it's just not clear how the money, so how the money was distributed, and I think the last information I got was that it hadn't been allocated completely because the crisis ended. I am naive, and I just thought that $150,000 would stay in the food security line if there was such, and it would somehow be distributed, because I keep hearing, like, for example, the Meals on Main program, you know, it's more and more of a crisis right now. So, but like my question to you would be, I know we're going to save questions for the end, but we might as well for the sake of continuity, you know, considering the Meals on Main issue and your distribution, I understand that Second Chance Food is the #1 distributor of prepared meals throughout the county, and how you go about doing that with the burden of, you're a not-for-profit, you're barely government funded, your property is not on any government property, I understand, so you have rent and property upkeep and things like that. Like, how do we get to helping organizations like yours, let's just say, because I'm not making any decisions here, to distribute that food?
Yeah, again, I think it's like not a $150,000 project, you know, but maybe there is an opportunity to keep this project within the county instead of a, you know, agency that's all the way down in Portchester, New York, to, you know, develop some kind of a roving truck. It's always been a dream of mine. We have a trailer that, you know, could get pulled by a truck, but, you know, it'd be a whole nother program we'd have to develop in order to make that happen.
Great.
But we'd be willing to, you know, work with the county on doing that.
Great. I think, you know, while we're here, structure-wise, I'm going to open it up to committee members to ask direct questions, unless you want me to wait till the very end. And if you have questions for Second Chance Foods, or we could just do overall questions at the end. Let's hear from everybody. I think we're here to hear from other folks, and I see Marissa in the back there. Would you like to say this is Melissa O'Leary from Putnam Community Action Partnership, wonderful organization that faces the brunt of this also.
Thank you. Good evening, everyone. Putnam CAP is, as Nancy mentioned, a not-for-profit organization that works with low-income individuals here in Putnam County. Just to give you a point of reference, we serve approximately 450 unduplicated families each month through our food pantry program. And we have a soup kitchen program that's open 4 days a week, and that serves right now about 60 to 70 meals per day. So a lot going on. We spend about $75,000 a year to support our food pantry program. So this $150,000 is wonderful, but it is
You don't have
really
it.
just a small.
You don't have it yet.
Right, we don't have it. I do, again, want to just clarify the $150,000 that was approved in November. That went out to, was approved for 4 contracted agencies with the county, but then about a week later, we received notice because the federal government reopened that those funds would not be released, that we could be reimbursed for any expenditures that we had made in those couple of weeks. That directly impacted SNAP recipients who were impacted by the delay. But because we didn't have a mechanism in place as to what we were actually doing with those funds, we had that approval, but we didn't have the follow-up discussions. I know that Putnam CAP did not put in for any reimbursement. We were doing providing services that were already in place. So I do just want to clarify that.
Yeah, if I may, while you're on that subject, just
Sure.
for my colleagues here on the legislature, I wasn't aware of that, and I just, okay, nobody was aware of that. We passed a resolution to release those funds.
Okay, thank you. We service the entire county, but obviously it's very hard for us to do so on the western side of the county. We partner with other food pantries and other community resources to meet those needs. Obviously, the demand is increasing. We struggle with having enough cold storage space. We would love to be able to offer more milk, more eggs, more perishable items. We do offer those things, but we would love to have more cold storage to increase that amount.
Do you have the space to,
Not in our building.
okay, do you have a space in mind?
We have talked in the past about having a centrally located cold storage area that all the pantries could benefit from. We're all facing the same issue. And also, if there were some type of mobile food pantry that could go out, we would love to partner with that. We had been approved for ARPA funding to purchase a vehicle, but it was a very limited amount of funding, and it would not have paid for the purchase and the personnel and the gas and the maintenance for that, so we weren't able to implement that. It's certainly something that we would love to revisit.
And are there any other gaps that you want to make known right now in front of the legislators?
Those are the main
Thank you.
ones.
Thank you so much.
Thank
Thanks for
you.
giving us some insight
Yes.
and putting a face to the organization. Always love to
Thank
see
you.
you. I think I would really love to hear from Marlene Barrett from our Office of Senior Resources, who, you know, this issue really came about because one of my constituents and somebody that Marlene works very closely with did bring it to our attention. I believe he might be here tonight. Is Mr. Goggins here? Okay, but I thank him. It was something that the director of the food pantry in Phillipstown actually brought to my attention, and subsequently I got a message from him and got the ball rolling. That's not my car. I gotta go. It's my kid in the car. No, I'm kidding. Marlene, thank you.
Oh, no, thank you very much for inviting us here, and for everybody else. So kind of just echoing what everybody else has been talking about, you know, there has been a pretty devastating effect with moms no longer being on the west side. They did service our center, Chestnut Ridge, which is across the street, and the mobile home community, Brookside, I believe it's called, on Route 9. So being completely pulled from that area, you know, left
Devastating.
It was.
Yeah.
They left it with nothing, and kind of adding fuel to the fire. It still being in other areas, kind of was like, why us? You know, we've done our best to explain that. It was their boards. You know, they came to that realization. It wasn't fiscally able to do that as well. I guess getting
It seemed
there.
like, you know, it's a straight shot up 684 to this side of the county.
Yeah.
And again, I think I need to reiterate, this is not and was not a county program that was canceled that we're talking about here. This was
Correct.
a program, a partnership with an organization in Portchester that got a grant through and partnered with Cornell Cooperative. 2 private organizations providing services. Now the service is gone, and now we're like, what do we do?
Yes, and I think that
Basically.
was also like a
Yeah.
information that was out there.
They thought
We
I
also got a
canceled the
lot
program.
of, right, and considering that it was at our facility as well, like, why did
Yeah.
you do that? And I'm like, we were just the
It's
parking
okay.
lot.
Take it.
But, and the same thing, we have the freezer from Bountiful Meals in our facility as well. So we are still offering that. But we did have a conversation, I wanted to prep for this with some ideas. So we did meet with Ruby from Cornell Cooperative. She is kind of like the head of the food insecurity group, with the grants, the funding.
The USDA grant.
Yes, so she's the one that got the money for moms and over, they get the money and they pass it on down. I was asking her for a flow chart because I was trying to figure out who oversees what and where the money goes. But kind of I wanted to ask her, that this being her niche, like what was her suggestion? Why reinvent the wheel? And like you mentioned, the $150,000 doesn't really go a long way. So we were kind of thinking, maybe putting more money towards the Bountiful Meals program. It's already in place. I don't know if adding more to it, I don't want to speak to Martha's program, but I wasn't sure if that's even like feasible, but we wanted to, this is a need right now. So if we didn't want to make a new program or a new system, that's going to take a while to implement. We wanted, results at this moment. We were talking about, you said getting money to the food pantries, by the time you divvy that up, would it be enough, would it be worth it? How would we decide, would everybody get a piece of it? Where would it go through? There's, like I said, a lot of things to go over. But that seemed to be the most, things that can happen right now. She was mentioning that it's about $4 a meal to produce, so with the overhead, with administrative costs on the higher end, maybe $10. So we kind of were looking at for the rest of the year, maybe about 500 or so extra meals could be made if it was possible. So that was kind of our idea, but it's really sad that the west side got pulled from. Like I said, no fault of their own. The funding ended. You can't squeeze water from a rock, and it's upsetting that the federal funding is no longer available for them. But due to people have mentioned transportation, there's only the one supermarket. Food is very expensive. The one drugstore, just the community itself, there's a hardship. And I don't think people realize that on that side, yes, there's a very big threshold. We have people that are on the wealthier side, but there is poverty in that area as well that we see and we deal with every day. So we're hoping that something can be figured out soon.
These ideas and being presented with something we could do quickly and to that, relevant to that. I don't know if Kiko Latu is here from the Phillipstown. There's Kiko. If you wouldn't mind coming up, just because, Marlene, please feel free to stay because you guys are really, and Kevin is our Deputy Director of Office of Senior Resources, and he's been a great partner in keeping me in the loop with what's happening. But Kiko provides me with statistics and data to exactly what Marlene is talking about. So to keep it cohesive, why not just segue into one of our food pantries? Kiko is the director of the Phillipstown Food Pantry.
Great, thank you. I know I have a
Is that green light on?
It is.
Great.
Can you hear me okay?
Yeah, I don't know if everybody out there can. We get lots of complaints.
Can you hear me okay? I want to take advantage of this opportunity.
Bring
the mic in more.
And then bring it in.
We do have a problem with our live
Awesome.
streaming.
There you go.
All right, thank you. Thank you so much for the invitation. I know that the West Side isn't often represented on this side, so I'm going to take full advantage. Thanks for your patience. And you said 3 minutes. I'm keeping myself on track.
Thank you.
So Kiko Latu, I'm the Phillipstown Food Pantry Coordinator. As a mission of the First Presbyterian Church, we are proud that for more than 50 years the pantry has responded to hunger in our community. It's powered by more than 40 volunteers of all ages, backgrounds, including faith communities, Lions Club, Knights of Columbus, Haldane students, Scouts, etc. It's open every Saturday from 8:30 to 10. We serve roughly 80 households. So just to give you an idea, that's about 150 to 170 individuals a weekend on Saturday. And that's walk-in, but it's also 25 to 30% are home delivery, which we do through volunteers. People think Phillipstown, I think they really think Cold Spring Garrison, but we do serve all of Phillipstown, and that's from the two mobile, or residents of Phillipstown from the two mobile home parks up Route 9 near the Dutchess County border to Continental Village, which is, part of it is Putnam Valley, basically. Anyway, in terms of trends, since you asked about that, and we do have frontline experience, many pantry guests visit frequently, often weekly, indicating ongoing, not temporary food insecurity for many. Over the course of 2025, we saw a slow, steady increase, both in new and returning clients, with a notable uptick in the last quarter of 2025 when all of this, all these concerns were going on. What I want to talk about is in the first quarter of 2025, so we're talking January, February, March, pantry utilization increased 41% compared to the same period last year. Looking back to pre-pandemic, or maybe a more normal time if there ever has been such a thing, this is close to the total number served during the entire year of 2018. So just as a measuring stick. It's a big jump. I'm concerned. We're managing. We're managing at this moment. We were just talking, Riss and I, before. I'm wondering where we are in the wave of need. So gaps, barriers, and challenges, coming back to your question. A few pain points for us. Transporting food, so having large enough vehicles, volunteers with time to go get food. Our setup day is on a Friday. Sourcing and storing enough food. We actually expanded our capacity last year, but I thought we would be stocking up. Instead, we're going through everything we have pretty much every week, or much of it. So sourcing and storing enough food to keep up with demand. Looking ahead, food pantry runs on donations by neighbors. And that's, often 10, 15, 20, $30 checks. If we are all pinched by increasing costs, gas, electricity, food, transportation, folks may give less cash, time, food at a time when more of everything is required. I can't tell you everything in 3 minutes, so I'm going to choose one thing. I do want to talk about the Meals on Main just very quickly because I think it's an illustration of a challenge and an opportunity. So as you've all heard, the recent suspension of Meals on Main in Phillipstown, it really illustrates how fragile the safety net is for food insecure neighbors. And although the program provided, staples and food stocks only once a week, the loss was enough to push 5 new senior households to enroll in the Phillipstown Food Pantry. Others have shared with me in informal chats with our guests that they too relied on the service for helping them keep food on their tables. So for food insecure households, especially seniors and single parent families, not limited to, but those are 2 particularly priority groups, even one disruption can create a chain reaction. And at a time of funding cuts, rising food and kind of all other costs, especially fuel, the changes in SNAP requirements, bless you, and responsibility for the administrative costs for SNAP. Still looking forward to hearing more about where that's going to land. Families are, already living on the edge, have very little cushion when any part of their support system disappears. So if one support drops out, it really strains the informal safety net. And I'm proud that I think we have a really good collaboration in Phillipstown and beyond. We're doing a lot to creatively solve problems together. So I'm glad to be able to share this quick update and my concern. I think the opportunity, as I think you even put in your outline, Nancy, is building relationships, new opportunities for collaboration, finding solutions together. Money is not the only answer, so I'm really curious from the county side, what are resources available, maybe not just money, but where are there overlaps and untapped capacities so that we can better serve Putnam County residents together. Thank you again for the opportunity.
Thanks, Kiko. Thank you so much. Wow. So I I also have, now these are just folks that responded that they were going to be here. I thought Stacy Littner from the Regional Food Bank or Susan. Stacy, there is a Stacy at the food bank.
I'm a Stacy,
That's
she's a Susan.
Thank you. This is the Regional Food Bank where I know I personally have, can I make a motion to accept the additional?
I'm so sorry.
No, that's great. That's fine. Pass it out. Oh,
Second.
all in favor?
Aye.
Thank you. Yeah, if you've been involved with any food pantry in your community, sometimes you're ordered to be the driver to go to the regional food bank to pick up the food and then put it in your little Honda.
So I want to thank you all for having us here tonight and for really shedding some light on the often hidden issue of food insecurity in Putnam County. Tell you a little bit about the Regional Food Bank. So we are a regional organization serving 23 counties on the eastern side of New York State from the Canadian border to the New Jersey border. Last year alone, we provided 53.3 million pounds of food, equivalent to about 48 million meals to individuals in our region. We did this in the face of cuts of 7 million pounds of food that we expected from the federal government last year, including 1 million pounds of food from the same program that had been funding the Meals on Main program. So we are feeling these things on a big level. In response, we have not rolled over. We've been much more proactive in terms of sourcing as much nutritious food as we possibly can to get out to our network. But it's been a challenge. Demand throughout our network, including here in Putnam County, has increased. A little bit about who we are and who we partner with. So we partner with a network of over 800 food pantries, soup kitchens, and shelters throughout our 23 counties, including 17 agencies here in Putnam County. But what we also do is look at areas that are lacking service or pieces of communities that may lack transportation in certain areas. And our tagline is for every neighbor in need, and that is not based on where someone lives. Food access shouldn't be determined by your zip code or your age or your ability to access transportation. So we work very hard to overcome some of those barriers. First and foremost, we do that by working with our partner food pantries. So want to acknowledge Putnam Cap for speaking, and for Phillipstown's Food Pantry speaking tonight. We can't do what we do without them here in the communities every day. But really, there are still gaps. So we offer senior programs at 6 sites here in Putnam County, including Mahopac Hill and Brookside Park, which we just launched this month. Brookside Park was actually launched in response to the loss of the Meals on Main program. And I do want to acknowledge Amy Robillard from our team. She is our senior programs manager. She's probably hiding in the hallway. She is hiding in the hallway. But her job is to identify where these pockets of seniors are. So thank you, Amy. Sorry, I didn't tell her I was going to do that.
Are there any more food folks in the hall there?
But Amy is an unsung hero who goes out and really works with communities. So if we know of other senior sites, we currently have some funding through the Field Hall Foundation to launch some programs at senior sites. That might fill a temporary gap. Startup funding, as you all know, contingent on us being able to fund the program long term. But at very least, we're very happy to be able to step in at this time and help those seniors. A little bit about the state of need here in Putnam County. 9% of the population, so that's nearly 1 in 10 of your neighbors, is food insecure. Over 8,700 people. 3,000 of them are seniors. So disproportionately, this is affecting the senior population in your county. But also, there are 1,250 children here who may receive free breakfast and lunch, but may go home to questionable resources at night. So, and of course, their parents who are just as deserving as food access. So, want to make sure we highlighted that. Always like to put a face to this. So I asked Amy right before we came in here, can you tell me a story, since we just launched at Brookside Park this month? And she said, sure. I actually just got contacted by a tenant board member at Brookside. Her name is Cindy. And she said that she can't express how thankful she is to be receiving these groceries now. That her copays on a medication she takes just went up from $60, which was difficult, to $240 every month. And when you're a senior on a fixed income, how do you make that up? So that's really what we're dealing with. Just wanted to leave you with that. According to Feeding America, the meal gap, so if you look at all the people who are food insecure and exactly how many meals that they're missing, in this county alone is 1.6 million meals. So we distributed 924,000 meals through our network of partners in Putnam County last year. That means that there's still another 728,000 meals that need to be made up. And so we are looking with our network of partners, how do we make up that gap? So, you know, we want to close the gap, but we need county support to do that as a network. Many counties are currently contracting with us to make this happen. We work with Albany, Saratoga, Orange, Montgomery, and Rockland. Lots of counties come forward in times of crisis, and we're so grateful for that. You know, we were happy as an organization to be able to respond during the SNAP crisis last year, but really, our partners are responding to crises every day. It's not just when SNAP doesn't hit the bank account. So we are here as a resource if anyone has any questions, and I really just want to applaud the efforts of our partner pantries that are in the room.
Thank you so much. It's great to put a face to the organizations. We did have another response. I'm just going down a list of folks who responded to that they were going to be here tonight. I know many more are here, but we do also have the sweet potato gem of the Hudson Valley from Davern Farm. And if you'd like to say a few words, Stacy, we'd really appreciate it. Thank you. I'll let you introduce because I can't do what you do justice.
Thank you very much. So my name is Stacy Farley, and my husband and myself operate two farms. They're both in Phillipstown. One grows organic vegetables, and we grow 100% of what we grow goes to food pantries. We're sort of trying to crack this nut from a different perspective. We're just trying to grow as much food as we can and give it away as fast as we can. The second field that we farm is in the town of Phillipstown, and it belongs to the town. And on that farm, we have what we call the sweet potato dig. We grow an acre of sweet potatoes and a little bit of butternut squash. And once a year, we have a town-wide dig where we dig it up and give it to over 21 different pantries and soup kitchens and banks. So it's another way to, we realized that you can struggle to get food to the pantries, or you can also grow food to the pantries. So that's what we're trying to accomplish. And last year, between the two farms, we grew about 50,000 pounds of food. So.
Anything else about Pantries? I know you see a lot. You're out there. You're dealing with CHOP in Beacon. In Peekskill and.
Yes, we cross county lines. We
You
serve
do.
pantries in Westchester, Dutchess, of course Putnam, and Rockland. And we really don't care where the food goes as long as it goes to people who need it. And we just try to get it out of the field and to the pantries. We try to get it there within 48 hours because we believe everyone deserves fresh food. It isn't always that fast, but we try. We operate, we have a very small staff of farmers, and then we have a huge amount of volunteers, and that's how we do it.
Great. Thank you. Thank you so much. I know there are a lot more folks here from food organizations. Is there anyone that wants to just introduce themselves and their organization before I ask my committee members for comments? Hi, how are you? Would you like to come up to the mic?
No, I'll just talk.
Great.
I was a kindergarten teacher, I'll talk loud. I'm the coordinator for Gilead Presbyterian Church, and I just want to say thank God for Hudson Valley the Regional Food Bank and for Second Chance. We really spend a lot of money that has been given as a donation to the food pantry to buy milk every week, to buy bread every week, to buy eggs every week, along with the food we get from the food pantry and Second Chance, and the vegetables from Second Chance. And I want people to know in this area that it is so appreciated, and we have about 30 volunteers, and it's so appreciated when somebody comes for an hour to help just carry boxes up and down the stairs. We had, about 3 years ago, we had 25 people per week, for our little 2 hours that we do on Friday morning. Now we have 55 families in those 2 hours. And all of a sudden our food is just flying out. But the money that is donated to the food pantry is so important. And the food that people just stop by and leave, a can or two or a box of cereal in our bin outside the church has made a huge difference. And the schools also, people don't realize it, but the schools might have something where everybody brings a thing of cereal and they have a big domino thing, and then those boxes go to the local food pantries. And the cost has gone up so high that it's invaluable. So if people, think, what can I do just to help a little bit, drop a couple cans of food off, put $5, in an envelope and donate it to a food pantry. But people are so grateful for the food they get. And thank you.
Thank you so much. Before I open up, I need to clarify something, and I misspoke probably before, and it was a memo that came from the county executive a while ago in November in response to a couple of memos I sent regarding, I really wanted to know how that money was distributed, and the memo stated that seeing that this shutdown had ended, our intention is to reimburse expenditures up till the end of November 14th, which I believe Marissa spoke about a little bit. But this way, any unspent funds may remain unencumbered and available should we find ourselves in a similar situation with the federal government. Well, the situation is beyond the federal government now, and the big beautiful bill has caused and wreaked this havoc. So we're in a situation, so that $150,000 in 2025 is in an unencumbered, not designated for food anymore. So I'm concerned about that, and we also have this $150,000. It's all a drop in the bucket from what we're hearing now. Obviously, this is just one night, and obviously this is a way bigger issue than one night. So with that, any comments from my colleagues on the committee?
Thank you.
Yes?
Yeah, I would.
Great. Legislator Adjournment.
Thank you.
Sure.
Just looking at this that was handed out, it's amazing, and I think many people are unaware of this happening in Putnam County. 8.9% of the population in Putnam County, that's 8,720 people, food insecurity in Putnam County. I would like to see Putnam County partner with our food pantries. As was mentioned, it's being done in Orange and Rockland County. I would like to look into this more and to see if there's anything that we can do. 150,000 is a drop in the bucket. Maybe there is a facility where we could, somebody did mention, I don't remember who it was, have a place where we could have the food storage with all the freezers and refrigerators in one central location. And maybe that money also could be used for that.
Over on the west side, right?
So I think it's something we really need to discuss further.
Thank you. Legislator Rousseau.
Yeah, I just want to thank everybody who came in to share. I do see some of my constituents here and members of my local food pantry who do above and beyond for all our neighbors. We have to do something. I do know that the Regional Food Bank is a huge agency, so I'd like to do, you know, anything we can to help out. Thank you.
Thank you. Oh, there's some, hi, I'm sorry.
Sorry, no, it's okay. I'm like tucked away here in the back.
Yeah.
My name is Juan Cabrera, I'm with United Way.
Oh, hi.
I didn't respond.
Okay.
I had no idea what to expect. This is like my first time being in a room like this. But I can speak a little bit about what we've been seeing, especially over our 2-on-1 calls.
Great, welcome to the microphone, because then the folks at home
Okay.
will really hear you if you can make it through the crowd. Thanks, I'm sorry I didn't, I
No, not at all. And I'll be quick because it's just...
Thanks.
Yeah, for sure. Yeah, so I've been at United Way for 4 months so far. And I've been connecting with the directors for each of our programs. One of them being 211, which is a resource information hotline for people who need access to resources. We connect them through that number. And one thing that I noticed today before coming here is that calls around food insecurity for 2025 didn't reach 1,000 calls. We're in May, and we had over 1,600 calls.
Wow.
So there's a large growth of calls coming in around food insecurity. So for our partners here, for food pantries, for folks who, if you see people coming in and you can't serve them, I encourage you to have them call our 201 line, because at the very least we could try to connect them to another local food pantry that's close by. And if transportation is an issue, maybe we could connect them to some transportation programs if they exist in the area. So that's all I wanted to say.
Thanks for connecting with us here tonight. Any legislators have a comment? Sure.
I just wanted to add that with what was just mentioned, sometimes people reach out and they have a surplus of items, food or not even food, like, personal products, and they don't always know where to go. So I think if we can, as a county, have like a little hotline or something on our website.
Bring stuff. Yeah, I just had that with equipment for senior citizens.
Yeah.
They couldn't get rid of it.
So I do get a lot of people that donate items to me, even if it's a bicycle or some kitchen supplies, and I know there's people that could use that stuff. It's sometimes hard for people to get rid of items, whether it's food or not, and I think that would be a good resource.
Thank you. Thank you, Legislator Birmingham, and then Legislator Sage, or you first.
Well, yeah, just briefly, and thank you to the chair for putting this on the agenda, and thank you for everyone speaking here tonight. I've said this before, every census that comes out, and then they do annual updates to the census. Putnam County is generally ranked within the top 12 to 15 richest counties in America. And yet, to hear that, and we all knew it was happening, but to hear this firsthand that we do have this type of food insecurity that exists in one of the richest counties in this very wealthy country. Obviously, there's a need there. From a practical aspect, the 150 that we have in the 2026 budget, I imagine this committee, through the rest of us and with the administration, and maybe more hearings, will work to get that money directly to the providers. I think and again, I'm just 1 out of 9, I think the best way we can use this money is for direct food purchases or direct, I heard something about gift cards from supermarkets, things like that. Getting the food into the pantries to the direct providers, I think would be great. And I'd like to see all of this money spent on food and none of it spent on, because I don't think this is going to be a problem. All these organizations sound like volunteer organizations. I'd rather see the money spent on food and not any sort of staffing needs I mean, it sounds like the infrastructure is already out there. That's with the first 150. To the extent we have the unencumbered 150, I also heard a lot about long-term, obviously food's expected, people eat it, it's gone. But I also heard some needs about infrastructure, about freezers, about perhaps transportation issues, about physical things that might have a longer-term impact. Maybe that might be a phase 2 within this year. We can take it out of contingency. to address that need, because I also heard that as well. In addition to the people being hungry today, obviously, unfortunately, there's going to be people who are hungry next year and the year after. And while perhaps food we buy today won't be there for them, perhaps a freezer or something that we, again, it's not a gift. It's part of the county doing its own mission. If we buy some infrastructure that is put into use by a county contractor, again, that might have some long-term benefits as well. Just food for thought. Thank you.
Thank you, Chairman. Legislator Sage.
Thank you, Chairwoman. So in 2020, we all saw what food insecurity did firsthand to our county, to our neighbors. I just have a little story about that with some of the providers that are here today. I was talking with my friend Faith Ann Butcher. She was working for the United Way at the time. I had a small little not-for-profit and was unable to do any fundraising. So I pledged all of the remaining of my bank account to work with the United Way to see how we could get that money out to help people. And she said, hold on a second, I've got so-and-so on the line from the Hudson Valley Food Bank. So she spoke with the Hudson Valley Food Bank. We had a little idea. We called our Commissioner of Social Services, Mr. Mike Piazza, and we set up a food distribution in the parking lot of the social services parking lot, just from that little spark from the United Way, and then just having the access to the Hudson Valley food pantry. And every week we distributed food. So to see you guys in action and to see how you provide services for our constituents, for me, since I'm a legislator, but to see from beginning to idea, spark, immediately the next week we had it lined up. I went to the grocery stores and I bought a bunch of bags that we could use. And I got to see people that you would not expect coming in and picking up food, and week after week after week, and it was seniors and it was people that you wouldn't expect. So we do have a food insecurity problem, and they're many times invisible because they don't want to tell anybody that they're food insecure. It's embarrassing. So anything that the county can do, I'm very pleased that we were able to put aside this money last year, because it's not just during a pandemic. It does stress the food insecurity that much more, but it's all the time, and I think this is something that we really need to concentrate on, and I thank you all for everything that you do to provide services for these food insecure families.
Thank you, Legislator Sage. Any other?
Sure. You just made me think of, I was there with you.
Yep.
We were there every week, we had masks, and we were there handing out the food, and it was wonderful. But at that time, and I didn't mention it previously, but I had the ability to partner with Martha Elder, who's absolutely has a wonderful organization, nonprofit, and I was there every week. We went on up to Mount Carmel Baptist Church, and they use all their volunteers. To this day, they're still doing it. I handed it over to them because I did it for like 3 years, I think. But Martha, what did we start out with, like 14 boxes of food?
Something
And
like
we're
that.
up to what, 100 and what,
Yeah, more than
More than
170
100?
boxes.
Almost 190, I think there was 90, yes. So it's food prepared, 90 boxes. And the volunteers go out and actually deliver some of them, because people can't, some people are homebound and they can't get out.
Transportation's a
But
big, yep.
it's a wonderful nonprofit organization that Second Chance Foods provides for the county. All of you are wonderful, and I just wish we could do more.
Thank you. Any other legislators would like to speak? Legislator Goldman.
Thank you, gentlemen. I'm glad that there's a lot of providers here. I understand and I know firsthand that there is food insecurity, not just here in Putnam County, but throughout the whole region. For a while, my wife and I have volunteered at the Putnam Valley Food Pantry, and it's not the typical person that comes in there. I guess with all food pantries. You know, you have some people who are definitely down on their luck, and they're there every week. Then you have other times where, yes, yesterday a person wasn't hungry, but this week they are hungry. They come in with a very expensive car, and some people get very disturbed about that. But the reality is maybe they lost their job, and that's their only means of transportation. So, you know, the realities of life. People do go paycheck to paycheck. We do have that situation, not just here in Putnam, but, you know, everywhere. And we really should do something. 27% of the 27% of the population of Putnam County are senior citizens. If you've been retired for many years, you don't have the savings that some other people might have, and they're living on Social Security and the taxes that they pay here. It's really, they're going paycheck to paycheck, and they're not eating. That's why when you go to a senior center during the day, it's packed with senior citizens. Whatever I could do, whatever this legislature could do, I would support something to help the people here, because like was mentioned before by a legislator, we do live in a very wealthy community, but not everyone's wealthy. And the homelessness isn't as great as other places, but you know what? There are people who live in rundown homes because they can't pay to fix it, and they can't eat, and that's a major problem. So thanks for listening to me, and I understand what you're saying, and I will support it.
Thank you, legislator. Any other legislators? Thanks. Before I'm going to open up to the public. Yes, Legislator Crowley.
So I think some initiatives too that have been local that I think we need to do more of too to help with this. I know Legislator D'Angelo and I did last year was stuff the truck over in Carmel. We did back, it was during the issue with people not receiving their food stamps and or SNAP benefits. And I think more local initiatives, trying to get out the younger kids for community service hours. There were so many kids that came out for that. It really drove them. They were organizing, they were doing all sorts of things. So if we can get that, maybe through some of you guys, I'm sure you've done it all, but, get it into the high schools and the middle schools where they start, building up those hours and their stuff in a bus, a truck, a Jeep, whatever it may be, and then they can come back and donate it, would be a huge help too. And it's local and it's easy and it's something to keep them out of trouble too. So I recognize, mom of 4 boys, so. I think it's important that we do, small things too as a community. So that's it.
Thank you.
They do large things.
Thank you. Anybody else? Thanks. Anyone from the public? Kiko, thank you.
Yeah, just a really quick, Cornell Cooperative Extension put together a list of food pantries that was quite current here in Putnam, earlier this year. So I'd be happy to find that and send it to you. And also, if you go to the regional food bank and there's a button that says find food, just put in your zip code, and that's a very quick way to pull up what are the food pantries closest to you. So if you're interested in, finding where they are, that's just a helpful, take you 2 seconds.
Yeah, thanks for being my resource for a lot of that information. Appreciate it. As a tiny food bank director. Hi, welcome. You wanted to say something?
Hi, my name is Zoraida Lopez-Diago. I'm with the Glenwood Center for Regional Food and Farming. I had a pleasure of presenting to everyone last year. Come on up to the mic.
Feel free. Okay. Sorry, I didn't. You did email me.
Yeah, it's okay.
And I'm sorry.
It's totally fine. Again, my name is Zoraida. I'm with the Glenwood Center for Regional Food and Farming. We're based in Cold Spring, New York, right in the middle of Fonsstock State Park. We have a 250-plus acre farm. We donate about 25% of our veg and our protein production to folks in Putnam County. I know Martha quite well. And we were actually just talking about one of our programs today. Our CSA is a SNAP program. So it's a program where we offer CSA shares. That's community supported agriculture. It's shares where you pay up front for a share from a farm, and you pick up a box of fresh, local, usually it's produce. And we're able to partner with farms throughout the Hudson Valley to offer that to folks on SNAP, with SNAP benefits where they can pay week to week, because usually with the CSA share, like you pay at the beginning of the season, folks on SNAP can pay week by week, and we subsidize half of that cost. So the farmer gets paid, and the folks on SNAP can pay half of the share price for the full benefits. What we're seeing is production costs increasing for farmers. So we initially anticipated in 2026 that we would be able to distribute about 750 shares to folks in the Hudson Valley because of, you know, what we're talking about, increased food production costs. We're only going to be able to distribute about 550 shares, and the need is to reach over 1,200 families. So we have like what the need is, what we can do, and our initial capacity was for 758 families. We were also impacted by federal cuts and state programs ending, and are trying to fill that gap with applying for funds from private foundations, but that's a very movable target because you don't know, how much you're going to get, and that's kind of the boat that we're in right now. We have another program that I'd be happy to share information with that we've done that has been very helpful at 2 or 3 different sites. We've had mobile storage units where multiple farms that deliver to food pantries, they can leave their produce there. Everyone shares like a code or a lock, and when the pantry can pick it up, they just go to that site, because the coordination part is really hard. And so that's one of the things that we've been tackling too. So it's like the food cost and the storage cost is something that we constantly are facing, and we want to have more mobile fridge units throughout the Hudson Valley. So I'm happy to kind of share information on how we were able to do that. We wanted to expand it, but the same thing. It's just the cost of these mobile units.
They seem to be the most effective.
They're super effective. Yeah.
To address this.
Yeah, and we found at one of our sites at the Northeast Community Center in Millerton has a cold storage unit that multiple farms and food pantries use, and then across the street a sliding scale grocery store just opened. And so folks are accessing healthy food in multiple ways.
A sliding scale grocery store.
Yeah. Funded by a foundation. So it's a lot of, it takes a lot to fund this work.
Thank you so much
Yeah.
for your information and coming out. I'm sorry I didn't acknowledge you before.
Absolutely.
Yeah,
No
but it's so
problem.
great to see you. And thank you. I really, truly appreciate everybody for taking the time to be here tonight. Obviously, this is not going to be solved in one night, but before we close the discussion, I think in order to make sure that we keep it going, I'd like to propose I'd like to establish a county, Putnam County, let's give it a name, Putnam County Hunger and Food Access Coalition. So I'll do my part because you guys are all boots on the ground doing your part, and I'm here with papers, and I think with social services and the Office of Senior Resources, and we'll get community partners and maybe just a person from the community to establish this task force. We'll call it a coalition, and hopefully I'll have that formulated by the next health committee meeting. But this is the first of many discussions, and it's a really important issue, and I still have that constituent's voice in my head saying, you have all these departments in the county, but you're not addressing food. So now we are, and I thank you. Thanks for coming out. I don't have any original ideas. It all comes from my constituents. So the next item, I've lost my agenda, if that's okay. I'm going to move right on. The next item on the agenda is, we're going to keep moving along, guys, so if you can leave quietly, please. The next item on the agenda is the update and the status of ARPA funds appropriated for mental health and a contract with People USA. So that item, discussing the ARPA funds and the status of the contract, I requested actually at the suggestion.
Additional motion to accept.
Oh, sure. Motion to accept the additional for item number 5. Thank you. At the request of, at the suggestion of Mary, who's such a great clerk, I did, promise to put this on the agenda until it was resolved. So here it is again, whether or not we get the answers we need. So as you all know, there's been an ongoing discussion regarding the future of these appropriated federal funds following the planning board denial of funds associated with a stabilization center. So just yesterday, I received additional correspondence and information from the county executive regarding the current status of the contract and ARPA funding considerations. So after reviewing that information that I got just yesterday, and considerable discussion over the course of many months regarding both the behavioral health needs in Putnam and the federal ARPA requirements tied to these funds, I believe it's important that this committee begin discussing a formal path forward, understanding that there was no attempt by the administration to seek options to keep these funds in their mental health use when they found out in January that they couldn't be used for a stabilization center. Instead, we discussed paving in January, and we had basically 11 months to figure out how to use these funds and keep them in mental health. So tonight, there's still some months left in this year, and I'm taking this opportunity to suggest that we pass a resolution that I just put forward regarding the approval and the budgetary amendment for county ARPA funds. So it's not an attempt to revisit the previously denied site application or to impose a stabilization center anywhere or at any particular location. That was never the intent. Rather, this is an effort to responsibly evaluate how these federally appropriated funds for public health can still be utilized for eligible behavioral health services, consistent with the original purpose approved by the legislature and still on record with SLFRF and the federal government for mental health. So I believe we have a responsibility as a legislature to at least explore whether these funds can still be utilized to support those needs, rather than just abandon the original public health intent. So I'd like to introduce the resolution before you. Approval for the community-based behavioral health stabilization services. And I'm sorry I didn't show this to you, Commissioner, but here we are in May, and these funds are at risk for being lost. And so you guys just got this resolution, but it basically mirrors the resolution we passed in 2022. We took out the word center and we put in services. If you want, I can read the whole resolution. But basically, Putnam County desires to preserve the original public health purpose of the ARPA allocation through flexible community-based behavioral health stabilization, psychiatric hospitalization, emergency room utilization. It's a diversion of that. And whereas the Commissioner of Finance has requested a budgetary amendment to allocate ARPA funding toward community-based behavioral health stabilization crisis diversion initiatives. And I laid out the cost for what it could be considered of. Commissioner, come on up to the table.
Go get him, Sarah.
So
Paul's going to be joining me tonight.
Okay, and Paul is our Deputy Commissioner of Social Services.
Mental Health Director.
Mental Health Director, sorry. So many titles. I'm just Nancy here. So, Sarah, I know you have been talking about this. You were on the front lines when the Crisis Stabilization Center failed, sitting in those planning board meetings. I'm sorry I wasn't there to support you. I was here. And now, not now, but in January, we were left with this unknown, what we were going to do with this money. And I'm sorry that it was formally introduced as paving while we still had a hot contract with a provider. So here we are, my attempt to retain that funding for mental health. And in that, basically, as I said, it mirrors the 2022 resolution and lays out how we can allocate these funds for mental health, appropriations for community-based stabilization services, peer-operated crisis respite services, behavioral health recovery and peer support services, mobile behavioral health stabilization outreach, behavioral health facility acquisition, capital improvements, behavioral health workforce and crisis response, and behavioral health administrative reporting. Those are all needs, I believe, that your department has. And those are all needs that I believe that we could send an RFP out by next week, open it for 30 days, receive responses, and award a contract. And I believe we can spend $2.1 million by December, because the cost of these things could be buying a car. That doesn't take a half a year. It could be putting a down payment on an existing service possibly, depending on who we're awarding the contract to. So with that, I'm gonna hand it over to you.
I appreciate your optimism and getting all of these things completed by the end of this calendar year. I think for Paul and I, we spent a lot of time identifying needs. We've been speaking to our providers, to our constituents, and we know what the needs are. And we feel very confident that we will be able to come to you shortly with a plan on how to pivot and improve our system of care here in Putnam County. Respectfully, I don't know that all of that can be done in the next 5 or 6 months. I think that there's a lot of different departments outside of the mental health department. If it was just us, I would be having a different conversation with you. But when we rely on so many other departments within Putnam County,
I'm not
I don't
following.
have control over the RFP, the legal, the financials, like it. It's a different.
It's nothing to do with any municipality. It's an RFP that needs to be written up, and
But it might need to be written up for several different components of what you're identifying, which are needs, absolutely. And if this is what the legislators are wanting us to do, we will figure out the best way to get it done. I just have some concerns over accomplishing all of this in the next few
so
months.
in order to retain that $2.1 million for public health, how would you propose?
I don't have an answer.
Well,
for
this
you.
is a solution, and I think if it's not you putting pressure on purchasing to do the RFP, which I've already written for them, and have a month open door for answering the RFP. It's done by, the end of June. It's done by the end of June, July, August, September, October, November, 6 months to spend $2.1 million and not lose it. Or give it to the county executive for paving. But all I know is he had an opportunity to do this since January, and here we are. And we're gonna lose it for mental health. And if he's allocating $2.1 million out of the general fund, then I want both. I want $4.2 million for mental health. Because if we have it, then that's what we should be doing.
Understood.
So, discussion from my colleagues on the committee.
Well, this is a tough one.
I get it.
It's tough because, do we take a chance? Do we take the chance and try to, retrieve the ARPA funding? And if they say no, will we lose it? That's the main question, and that is what I've been talking about. If we can't do this, I believe that we should take the 2.1 out of the general fund balance, which we did mention, give this to the paving, and then we take that money out for mental health. So.
And what if they don't allow it
We
for
have
use
to
for
make
paving?
sure, what if they don't allow for paving? But we still,
Sorry.
we can still, I believe, won't lose it then. We won't lose the 2.1, because we're gonna make a deal, the 2.1 from the county comes to us whether or not they get the 2.1 for the paving or not. How's that?
Understood.
Is that a good deal? I just believe that, I know what you're saying, and I do feel very strongly that I would love this to happen, but if we lose this, we have nothing for mental health then. So that's just my.
You think he wouldn't Yeah, okay. Any comment? I understand that this is thrown on you last minute, but.
No, so I totally support mental health and the initiative. I do not want to lose $2 million of ARPA funding. But I think we have heard from multiple departments and representatives that it might not be a project that we can get across the finish line. So.
Too bad nobody tried.
Okay, so nobody tried prior, but we're at this deadline now. So instead of harping on the past, let's move forward. We were promised 2.1 out of the general fund and move this money for ARPA towards paving for a deadline. If we do that and paving doesn't get funded by ARPA, mental health still gets their money.
Okay, you know what? I'm gonna call a vote.
And just wait, with that said, if all these departments are saying they don't think they could get it across the finish line, then we've been wasting days and days on this.
Just to be clear, the mental health department will be able to accomplish the task. It is the entire system.
Right, and that's what I'm saying, it's all the different departments working together to get it across the finish line.
Okay, we're back to this discussion that we've been at for months, so I'm gonna call the vote on the proposed resolution, the additional that we have before us. This is an approval for Commissioner of Finance, a budget amendment for the Commissioner of Finance for community-based behavioral health stabilization services. Can I have a second?
For approval? You're
Yeah.
looking to
Approve the resolution.
I want to approve it, but I'm concerned. I want to approve it.
I understand,
But,
I just want to
I
move
mean,
it along.
I would approve it, but from what I heard tonight, I'm skeptical. And looks like you put a lot of work into this, and I appreciate that.
Well, this has been so many months
I know.
of conversations, and it's just all dumped into one
I
document.
appreciate what you've
Thank
done
you.
here, and I do agree with you. I would love to do this, but I think that if we have to take another route, I just think that, why can't we get the 2.1 out of the general fund? But we need to be, that has to be a sure thing.
Okay.
Could I make a comment as a legislator?
Sure, we don't have a second on the motion, so I don't think there's going to be a discussion. So the motion doesn't get a second. So with that, what do I do? It doesn't get a second.
We can discuss.
We don't need to discuss it. It's, we got our update. Apparently, the contract is canceled for convenience, although we've not seen that in writing again. And here we are. So I think it's fair for this committee to say we're not going to move forward with trying to keep these funds in mental health. The county executive apparently has moved forward with canceling the contract, and the administration can move forward with how they want to go with this, because I think we're done as a legislature, and the more we wait, the more at risk we are for losing the funds. I think we should take $4.2 million from the general fund now and put it in mental health, but that's just me. So with that, the motion fails, and I'm moving on to item number 6. It's not necessary, it's not required, legislator. I'm the chair.
It's in the.
I'm the chair.
No, you've made that very clear.
Item number 6, a
Clean.
budgetary amendment for 26A033 OSR Insurance Recovery Fund for damaged auto. This is pretty straightforward. Do we have anyone that would be purchasing for this? So this is in the amount of, it's from OSR, sorry. Insurance recoveries for a damaged vehicle, recovery funds in the amount of $3,170.57. No fiscal impact. Can I have a second?
Second.
All in favor?
Aye.
Item number 7, we have highway approval for Department of Social Services Youth Bureau reapply for New York State Governor's Traffic Safety Committee Highway Safety Grant, and it's a no matching grant. Hi Janine, how are you?
Good, how are you?
Janine Cunningham is from our Director of the Putnam County Youth Bureau.
Hello.
Thank you for coming.
Sure, hi. So we are looking to, the Youth Bureau, this is our 6th year reapplying for this grant through the New York State Governor's Traffic Safety Committee. We have, so we're applying for, it's $146,525. This grant is fully funded through, fully funded through the Highway Safety Committee. So we received approval from the Traffic Safety Board to apply for the grant as well. So now we are just coming to you as a, just to say that we'd like to apply for the grant.
Great program.
Yes, it is. So
that's all I have to say. It's a great program. Any comment from our committee members?
Just to say, it's for people that don't know, it's for young drivers, 16 to 20 years old.
Right, exactly. So we're doing a lot of different initiatives in the schools. We just started our Sydney program, which is educating high school seniors about the consequences of drinking and driving, texting and driving. So we were just over at Mayapack High School today, doing a lot of different things. So talking about distractions and
You just had the graduation ceremony.
Our youth court, yes, we did over in Phillipstown. We just graduated almost 40 new members on the Phillipstown side. So we'll see. We do receive highway safety. We receive cases from the town of Kent Police and also over in Phillipstown. We receive a lot of and Putnam Valley area. Any youth 16, 17 pulled over for different infractions, they would come to our youth court, so they get a second chance.
Do you know what the most common infraction is for that age group?
Yes, speeding on the Taconic.
Oh,
is big, huge.
Everything texting is like.
Yeah.
Definitely the Taconic is, they could be driving almost 90 miles an hour. Yeah, it's pretty bad. Yeah, so we put them through some educational courses through this grant.
It's a really great program. Thank you. Any other legislators want to comment? Legislator Sage?
I wish I had this for adults.
I was going to say seniors and high school.
I think everybody, the driver's license
like
like 20, 30, 40, they need to have a redo their driver's license.
That's right.
Education.
Great. Any other legislators? Anybody from the public want to comment on our great program and thank our great leaders for going out and getting this money and resources and programs? Thank you. So can I make a motion? I'll make the motion to approve the Youth Bureau New York State Governor's Traffic Safety Committee Highway Safety Grant.
Second.
All in favor? Aye. Thank you.
Great, thank you.
Thank you, guys.
Thanks so much. Thank you. Number 9, approval of budgetary amendment 26A041, DSS adjustment to, we're on 8, sorry, I'm skipping right through it. Approval budgetary amendment 26A039, DSS record 2026-2027, New York State Rental Supplement Program. Another great program. Thank you for going for this funding for us, and thank you, New York State, also. So we have Kristen Werner, our Financial Fiscal Officer from the Office of Department of Social Services, and Commissioner Sarah Servadio from the Social Services.
So this is an allocation that we receive from the Office of Temporary Disability and Assistance annually. It's been $100,000 consistently year over year for quite some time. We pass this through to a contracted agency to kind of administer this program.
Okay, and it's for $100,000, and there's no fiscal impact for 2026 or 2027. Any comments from my colleagues?
Just how many families have you, or individuals have you helped this year?
4.
4? Okay. So do you have money left over, or? No,
We never have
money left. Never did.
If we do, it might be, $500, so it's not enough to bring on an additional client.
Okay, any comments from any other legislator? Comments from the public? Great, I'll make the motion to approve budgetary amendment 26A039 for the New York State Rental Supplement Award Program.
Second.
All in favor?
Aye.
Thank you. Now, item number 9 is the approval for budgetary amendment 26A041 DSS adjustment mental health state aid levels, subcontractors. Looks like a COLA increase.
Yes, for $524. So we received a revised state aid letter from the Office of Mental Health that updated one of their funding categories for 4 different agencies. So in order to pass this through to those agencies, we just have to fund the lines appropriately. So there's no county match, 100% funded.
Thank you. Thank you for that.
Thank you.
Can I have a second?
Second.
All in favor?
Aye.
Thank you. And last on the agenda is number 10, approval budgetary amendment 26A042, DSS adjust mental health state aid levels for subcontractor CoveCare.
Yes, so at the beginning of this year, this agency had a modification to one of their OASIS certified financial reports that was originally closed out in 2022. Or it was for 2022, it was closed out in 2024. So we received the recovery notices from OASIS, and they gave us a designated amount that we were to recover from those agencies. CoveCare has since revised their CFR financials for that year, and OASIS did a revised closeout deeming the recovery less. So in order to fund those lines appropriately and pass those additional funds back through to CoveCare, since it was back in 2024, we just have to fund the lines in 26, so we're able to issue those funds.
Great, and their level funding, pretty much, is that?
For the most part,
Yeah.
there's some different program changes. It's all really dictated by the Office of Mental Health. They were not impacted by that COLA increase, but you'll see some of those increases throughout the year as those state aid letters come down.
I just, when I first got on the legislature, I did an analysis of funding for our mental health resources, and it was astounding to see how little the funding increased over the years, none at all. So hence my passion about the previous agenda items. And
Right.
we'll just keep talking and maybe get somewhere.
Thank you.
Thanks. As we start to lose programs. So with that, thanks so much.
Thank you.
Thanks for all of your work and seeking out those funds. Is there any other business from my colleagues? Oh, sorry, I have to move it. I make the motion to adjust mental health state aid levels for CoveCare. Have a second? Second. All in favor?
Aye.
And you put me on track, Chairman. Any other business? No? Have a motion to adjourn?
Second.
All in favor?
Aye.
Thanks. Thank you. That was the Health Committee. Stay tuned for the Protective Services Committee.
Good evening, everyone. Welcome. Calling to order the Protective Services Committee meeting. Here on behalf of legislators Adnizio and Montgomery, myself, welcome to the Protective Services meeting of May 13, 2026. I'll ask all to please rise, take off your hats, and pledge of allegiance. Sheriff Hess, would you lead us?
Sure. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. Item number 2 is roll call, please.
Legislator Adnizio.
Present.
Legislator Montgomery.
Here.
Chairman Regan.
Present. Item number 3, we have an approval for Budgetary Amendment 26A030, Sheriff's Office, receipt of grant funds for Putnam, Northern Westchester Women's Resource Center. Welcome, Sheriff Hess.
Thank you, sir.
The elaboration is necessary on this grant?
I don't think so. It was approved in the budget. This is for the house for the victims of crime victims. I don't know if we give the address or we didn't. I know it was controversial last time.
Yep.
So this is actually money we got back from the Women's Resource Center. This was a grant. We didn't know if it was approved when we went through the this case.
Excellent. For this item, any inquiries for the committee? No?
No inquiries, just a statement. I just always appreciate the partnerships when we leverage county resources alongside a really important not-for-profit like this, because it doesn't place the burden on the taxpayer. And we partner with local not-for-profit organizations to provide resources that we can't. It's always a great thing. So I'm really happy about this partnership with this great organization.
Great.
Thank you.
Any comment, questions? Any questions or comments from other legislators? Questions or comments from the audience? No? All right, that being the case, I'll make a motion that we approve Budgetary Amendment 26A30. Can I have a second?
Second.
All in favor?
Aye.
So approved. Thank you. Item number 4, we have approval for a Budgetary Amendment 26A032, Sheriff, repair 2 automobiles in patrol fleet.
Correct. I believe, if I remember correctly, these were 2 motor vehicle accidents involving deer. So we received the money back from the insurance company. We're going to put it back into the budget.
Oh dear.
Oh dear.
Oh dear. I think it was in Phillipstown too, so. Just so we know.
Yeah, when I if I may through the chair, when I leave my meeting every night, the chairman is kind enough to say, please take 84, Nancy. Please take 80, and I don't.
Okay, for item number 4, any other inquiries from the committee? Okay. Any comments or questions from other legislators? Nope. Anybody from the public? Okay. That being none, I make a motion for approval, Budgetary Amendment 26A032. Can I have a second?
Second.
All in favor?
Aye.
So carried. Thank you very much. Item number 5, we have approval for a Budgetary Amendment 26A036, Sheriff, record remaining expenditure and revenues related to Byrne State Crisis Intervention Programming Grant. Sheriff, you have the floor, sir.
Sure. This was a grant that started under the previous administration. It was bouncing around for a little bit. We actually got it approved by the state, and we're looking to spend, let me get the new number. I think it's in, where's it here? Yeah, it's 500,067, I believe. I have the breakdown of how we'd want to spend that, if you'd like to hear that also. You have it? Yeah. Okay, great.
Yes, Sheriff, that documentation is provided. However, we show this as 0 fiscal impact for 2026 and 2027.
Correct.
Even with the expenditure. Okay. Any other questions from the committee on this item? No? Any questions from other legislators, comments? Anybody from the public on this item? Nope. There being none, I'll make a motion for approval of budgetary, a motion for approval of Amendment 26A036. Can I get a second?
Second.
All in favor?
Aye.
Excellent, thank you very much. Moving along, item number 6, approval, budgetary amendment 26A037, finance, receipt of SICG, Statewide Interoperable Communications Grant, Formula Grant. Item number 6. Good, welcome, sir. We have Jim Oster with us, the Commissioner of Bureau of Emergency Services. Welcome.
So this budgetary amendment is at the request of
Bill Carlin, the Finance Commissioner.
That guy.
It is to transfer monies that were received by Putnam County for the SIG 24 grant from New York State. That's the statewide interoperable communications grant. It is in the amount of $422,645. And that is to go to tower leases for our radio system and software upgrades and maintenance for Motorola for our radio system to continue to operate. It's no cost to the county. We've already received the funding. It's just a budgetary transfer.
Okay, I'll take the opportunity to say that I have inquired about this particular line item as well, and despite the headline grabbing title of it, it is basically us paying bills for what we already owe. It's just a payment of bills. Any other inquiries or questions from the committee?
Zero, oh, I'm sorry, just saying zero fiscal impact.
Zero fiscal impact for 2026 and zero fiscal impact for 2027. I'm sorry.
Just wanted to thank Homeland Security, the Department of Homeland Security from New York State, who's helping us become more effective and keeping our people boots on the ground, firefighters and policemen and ambulance, and having our emergency operation checked in with the current century. So I'm really happy about that. Thank you.
You're welcome.
Any other inquiries, questions from other legislators? Anybody from the public on this item? Seeing none, I'll make the motion for approval of Budgetary Amendment 26A037. We get a second?
Second.
All in favor?
Aye.
So carried. Thank you. Next up, item number 7, approval for Budgetary Amendment 26A038, Emergency Services, Fund New York State Emergency Services IP Network Readiness Grant. Commissioner, you have the floor.
So we refer to this for simplicity as a EZNet grant, just an acronym. It's a budgetary amendment for monies, to accept monies from New York State for the build out and consulting of our fiber optic network that provides operational functionality to the 911 center. So it's approximately $63,000 to a consultant for technical consulting and $625,000 for the equipment and the installation necessary to effect that change. And that one is also at no cost to the county.
Any questions from the committee?
No. Not a question, just to make sure, this is a 5-year program. It says 5-year grant program starting January 2026 to December 2030.
So that would be January 2026 to December 31st of 2030, correct?
Yeah. It sounds like so far away, 2030.
Question, Commissioner. So that selection of a vendor perform these functions, has that part already been done? Has that been selected?
Yes, that vendor would be, just give me a minute, I'll pull that up for you. That vendor is called NYSTEC, NYSTEC. They're a technical consulting firm that a lot of the counties in New York State use in order to basically figure out where our system is now as far as the infrastructure and what needs to be purchased and installed to improve that system. Okay. It's a little bit too technical for people within the county to come up with feasible solutions. So we need to hire a technical consultant to assist us with that portion of it.
We love a grant that can help that happen, right? With zero fiscal impact. Any other questions from other legislators? Let the chair recognize Legislator Goldman.
This has nothing to do with this, but 911, everyone knows you call 911 if there's a major issue. We also text here in Putnam County. Do you happen to know off the top of your head what's the percentage of people who actually text for 911 or not?
Sir, I gotta call this here. Just if we can keep it to the topic at hand right here, we can have discussions.
Let's discuss that next month then. Thank you.
Right? We can have other questions. We have a lot on the agenda for tonight, and Commissioner Oster is readily available at all times to answer questions. But if we can keep it on focus, I'd appreciate that. Any other
I'll send you a
questions?
letter tomorrow, thank you.
Any other questions pertaining to item number 7? None? Okay, seeing none, I'll make a motion for approval, budgetary amendment 26A038, emergency services. Do I have a second?
Second.
All in favor?
Aye.
Thank you so much. Item number 8, we have the approval of a fund transfer 26T110, emergency services, development of continuity of operations plan. Commissioner, you again have the floor.
So since this item is requesting a fund transfer to hire a consultant, I've invited that consultant to be here with us tonight to answer any questions that you might have. So with your permission, I'd like to invite Seamus Leary from Meriden Consulting, Meriden Strategic Services, up to the table to answer any questions that you might have.
Okay? Good. Thank you.
Seamus, could you please join us?
So, Commissioner, before we hear from Seamus, can I have your perspective?
Yes, absolutely.
Thank you.
So for those of you who don't know, a continuity of operations plan, or a COOP plan, is a plan that most government entities have in place in order to ensure that the essential functions of our government continue in the event of an emergency situation or a hazardous condition. It's essentially a plan that would designate who your lines of successions are for your various departments, how funding is appropriated, how things are purchased in certain situations. For example, if we were to lose complete power or internet services or things of that nature, and we didn't have the ability to transfer money or request appropriations for certain things, we might need to have purchase orders on paper, for example. And that's just one example of how we need to ensure that our government's going to continue to function in the event of an unforeseen circumstance. So it's come to my attention in my short tenure here that the existing COOP plan that we had in place is severely deficient. Many of the sections of the plan are non-existent or have not been completed. And I think it's essential that we have a COOP plan in place for Putnam County as soon as possible. So to that end, I'm sure you're all well aware of the fact that I do not have a deputy commissioner or an emergency manager at this time. So I don't have the manpower to designate to facilitating the completion of the COOP plan within our own agency. So I'm requesting funding to hire Mr. Leary's company to assist us with getting that COOP plan established in a relatively short time frame.
And welcome, Mr. Leary. There's just a couple inquiries related to the commissioner. So it's to set the tone for everybody watching at home or in the back of the room, take note of the fact that Commissioner Oster and myself were neither in these positions at this time last year. That being because we're commenting on the severe deficiencies that are there of our much renowned previous commissioners who have sat in your seat. Heard a lot of praise for things that they've accomplished. So the fact that there's not a plan in place, there's a number of questions that this raises with me, certainly, and I'm sure with the other ones here, because I heard this last year as I sat in the back of the room. And you have just far exceeded the explanation of what theoretically this would be done. But beyond expressing my disappointment that this doesn't exist right now, right? The hard point has to be made, despite the fact the lack of your staff is, for continuity, we do look upon you for that, for continuity within your department. But why would you, sir, be coming to us for funding to do a continuity plan for the entire Putnam County government? Wouldn't that be, all of those items that you spoke about right there, many of them fall outside of your purview?
So I would agree with you on that. Ultimately, I'm responsible for the Bureau's continuity of operations plan, but I think in general, the Bureau of Emergency Services should make sure that we have a county-wide plan. So it's my intent to work with other department heads and other agencies to make sure that they also have a COOP plan and that we can incorporate all of the department's individual COOP plans into one county-wide plan.
It's a phenomenal answer. I would suggest that your agenda is already very full, besides taking on other departments' COOP plans, but I will allow the opportunity of some of my colleagues to ask questions as well. Anybody from the committee have a question on this one?
This came before us last year and it failed? Or we funded it?
No, it never made it out of the committee because of some questions, some of us, through the chair.
Sorry.
I'm sorry, go ahead.
Yeah, I can explain that. I remember that Commissioner Lipton sat there and the request actually was for $25,000. Inquiries were asked similar to what's going on here tonight. No answers were provided at that time. Subsequently, some documentation came in from the company that would have done that, but that still seemed to miss a lot of the inquiries that were live from the legislature at the time. And again, a lot of this body was not here at the time. So, but with this being said, and I don't know if you're aware of this, Commissioner Osler, I could be wrong, that we had a contract with said company prior to 2025, prior to 2024. There was a contract. Perhaps, Mr. Lee, can you fill me in on that? Did we have a contract with your company previously?
First off, thank you for having me tonight. We are assisting the county to recover from the 2023 flooding event that happened. So we've been working to help get funding from FEMA in the state to reimburse county funding to several $1 million. I don't figure on top of my head, but that's what we've been focused on. That does not include any kind of preparedness activity or planning. It was solely to provide technical support to assist in grant management for disaster recovery.
If I may ask a question related to that, and your fee for that was reimbursed through the FEMA recovery, so there was no burden on the taxpayer.
Correct. There was a cost share, but that's I think it's $25.75 that the federal government provides.
So we didn't go into the general fund to
For
pay contractors.
administrative costs, that's 100%.
Okay.
So there's that. So this was, it was presented to us last year. I do remember the conversation surrounding it. And I think first I'd ask, with this integrated municipal effort, so Commissioner, you did say that the COOP plan is deficient. So I'd like to correct our esteemed chair here. We do have a plan. We do have a plan. It's apparently deficient. Familiar. So where is it deficient?
So the COOP plan asks for a lot of information from various other departments throughout the county. I actually have a copy of it here. And if you want to take a look at it, I'm more than happy to share it with you. But you can see how many of the pages in the plan look like this, with no information entered where there should be information entered. So the effectiveness of the plan, should we need to use it in an emergency situation, would be not very effective.
Okay.
The information that is in the plan is outdated, and the contacts listed many of them no longer work for the county or the outside of county agencies that we would need to rely on in an emergency.
So, if I may, through the chair, I'm somewhat familiar with a plan that looks exactly like that, and that being involved for the past 20 years, every 5 years, having to do a 5-year hazard mitigation plan for the town and now for the county. So that's something that we're mandated to do by the state. It's not something that we take money out of the general fund to do. We don't hire a consultant to do that. It's participation from a task force that's established to do that. Currently, I'm part of a task force for climate resiliency, putting together a plan just like that. We've been meeting for the past 6 months, bringing in every stakeholder within the community, within the county, to address situations just like that. So we have plan after plan after plan. With all due respect, I've never seen us hire a consultant to do that plan. I'm a fan of bringing that information directly from the people that work here. So with that, I'm not being sold on this yet. So bringing an outside agency to help us organize where we have, we have a substantial amount of upper management and staff that I believe has been hired to do this. So I'm not quite there yet.
Understood, thank you. We're going to move on to other questions. for
Mr.
the-
Chairman, can I just comment on that?
Sure.
So in regards to the hazard mitigation plan, the county is also working on a hazard mitigation plan, and we do in fact have a subcontractor as a consultant. That subcontractor is Tetra Tech, and their cost is well over $100,000 to assist us with the hazard mitigation plan that is required every 5 years as a part of.
Funded through a grant.
That is funded through a grant.
This is not.
No, this is not funded through a grant. It's kind of a gray area because the money that we're requesting to be transferred is from a salary that is partially funded through a grant. So the money is in its early stages. Where we get the money from is from a grant. But no, this particular transfer is not from a grant. But we do hire consultants in order to help us with these plans.
Thank you. Chair recognizes Legislator
Thank you.
Birmingham.
Thank you. I was here last year too, and I do have to say, your description of this gives much more clarity than I received last year, so thank you for that. I'm learning more. But one of the things you talked about, Commissioner, was, for instance, emergency purchases and things like that. In an emergency, obviously, when you need to get something, we don't want you to be hamstrung. Your main focus should be implementing whatever resources you need without worrying how to procure them. But I do know that general municipal law of New York State lays all that out very clearly, and there are exceptions to our procurement policy. Our Office of General Services probably already has those already written down. So that's just one item. The other item is with respect to continuity of, you don't have a deputy now, but there is a deputy position. And obviously you, along with the sheriff and every other military or, law enforcement or first responder team, and of course you deal with all of the fire departments and districts, they do have a chain of command. So again, I'm trying to stitch it together. If your department is short-staffed, and it is, and we need to work on that, that's on us. I mean, we need to, I know you've been diligent in trying to fill those, and if it's a matter of finances, that's where you come to us, and I'm going to respond anyway. I know my colleagues probably feel the same way. But if your department's already got some staffing issues, I think the chairman had said, is this the best department to put it in? Those are just some of my thoughts, and they're not rhetorical questions. I love your responses, but that's just where I am. I just want to know more about that.
Sure. So as far as the staffing issues, we are in the process of the second round of interviews for the deputy commissioner position, and I expect to have a decision made on that person by the end of the week. So that will help with some of the staffing shortly after for the director of emergency management as well. I think it's important that we have this plan in place, and I think it's important that there is one central department, such as the Bureau of Emergency Services, that can oversee the entirety of the plan and make sure that it is completed to its fullest extent. You mentioned purchasing, and I'm not so sure that they do have a COOP plan in place or a mechanism for getting us the equipment or services that we might need in the event of technology failure, right? So say we needed something from Home Depot, for example. They're not just going to willingly give us that equipment or material without some sort of documentation that we're going to pay for that.
30 years ago when I was deputy county exec, I remember going out with the purchasing agent, Doris Galvin, who was in her mid-70s at the time, and we purchased chainsaws out of Dill's Best with a county voucher.
Sure.
And that was 30 years ago. I got to imagine we didn't forget about that.
No, and we could do that, and that's part of the process of ensuring that there is a plan in place to do that. For example, we need to have that purchase order printed and ready to go if we were to need to buy those materials or that equipment. We can't rely on printing one out from a computer if we don't have our computer systems working, for example.
We handwrote it. This was the old days.
Yeah,
I mean, we
sure.
didn't have munis, which is not a Latin term.
And,
But,
you know, and that's just one
yeah.
example, right? So we're talking about, what if the 911 center goes down? You know, what's the next line of succession? Where do we go?
I gotta imagine we have a plan for that.
We do have,
Sure.
we do have plans for that. That's being
Yeah, okay,
yeah.
Well, I gotta imagine
We have a
plan
backup
for that.
911 center,
Yeah.
but we need backup plans and redundancy for all essential services.
Okay.
You know, in the emergency services world, yes, we have plans for backups and redundancy because we can't fail, right? Our mission is we need to be there to help people no matter what the circumstances are. But that, you know, there's other departments, social services, senior resources, they all need to have plans in place that ensure that they're going to be able to continue to operate and provide services to our citizens should there be some sort of, you know, event that limits their ability in their normal capacities.
And can I just provide an example?
Just 1 second, because Legislator Crowley has been waiting for quite some time. I'll get right back to you, sir. Chair recognizes Legislator Crowley.
Thank you, Chairman. I did talk about this last year, probably more than I should have. But I'm in full support of this. I go back to 2017 with Dutchess County. They used a consultant. Rockland's used Orange has used a consultant. Dutchess County to date right now has saved $27 million in COOP plans from not having redundancy in services and having these COOP plans throughout all of their departments. And the thing with that is a lot of the departments don't know how to necessarily set up a COOP plan, so I think that's where a consultant comes into play. I can save the taxpayers quite a bit of money, like I said, with IT and making sure that we aren't being redundant. And I'm reading from notes, I apologize. I know you laugh when I do that, but cutting down time during emergencies, cybersecurity, consolidating technology, dispatching, procurement, fleet operations, improving grant eligibility for state and federal reimbursement, avoiding costly emergency contracting services during crisis, reducing overtime through cross-trained employees, preventing duplication of services of departments. There's a number of ways of how we can actually save money in all different departments and how this actually reflects. But it's a matter of, can these departments, and I'm not putting down any department heads, but do they know how to write the COOP plan to go alongside with kind of the nexus that Seamus is here to help with?
So, thank you, and all of that being noted, right, I think hesitation comes from the fact that as we look at Commissioner Oster and the two gentlemen sitting behind him and Mr. Tully, right, we look upon those individuals as being very competent and probably being able to, or should be able to fulfill almost everything that is being asked in that and in the proposal right here. So that's where I think the hesitation comes from, but recognize you. Sorry, go ahead, sir, please.
You know, again, thanks for having me, but one of the examples that I'll put forth is, I was the county emergency manager for Orange County during Hurricane Irene. Our government center was flooded out, and it was closed for 4 years. And we didn't have a continuity plan in place. We had emergency plans, which were externally focused, how we're going to help municipalities, how we're going to help the public, but we didn't have an internal plan to how the county was going to function in a degraded environment. And we spent a lot of time in the middle of the hurricane trying to figure out where the Department of Social Services is going to go, where is this department going to go, and because we didn't have that in place because we didn't have a proper functioning plan in place. So I just want to give that as an example of what you know, things can happen to that can really even if you think you have everything squared away and all your essential functions identified, you probably don't. And if you don't do a concerted effort, department by department, trying to identify all these essential functions, when an essential function is something that can't be delayed or stopped, right? Like the 911 center, for an example, it can't stop functioning. So what is the secondary backup? What's the third? What's the tertiary, and et cetera?
Thank you so much. Chair recognizes Legislator Russo.
Thank you. I support Commissioner Oster's request. Clearly, this failed at a committee last year, and we still do not have a complete COOP plan. This is a $20,000 investment in the entire county's emergency services. We just sat here and discussed $150,000 for food insecurity, which I 100% support, and now we're gonna not support a $20,000 investment for our entire county emergency services, whether it's police, fire, EMS. So I fully support this, and I hope it passes for you.
Thank you.
Thank you. Legislative Chair recognizes Legislator Anizio.
Thank you. I'm in favor of this budgetary transfer this evening, as it would provide funding for the development of the continuity plan. And as Commissioner Osser mentioned tonight, we do have a plan, but it is outdated and inefficient. So I think it is important to support this, and if we look at this, fiscal impact is 0 for 2026 and 2027.
Okay, are there any other legislators haven't been heard from? The Chair recognizes Legislator Sage.
Thank you, Chairman. I'm just looking at this more practically. I understand that we have a need for a COOP plan. And is this specifically for the Bureau of Emergency Services, or is this going to cover the entire county? Because you said that the Bureau of Emergency Services has to work with the other departments, but is it going to cover their plan too, or they have to come up with their own?
So,
What we're proposing here is we're going to create a core plan that provides the overall strategy for the county. It does answers the high level questions at the county level, right? It's going to do the order. It's going to indicate the order succession for the county government. This is all focused on county government right here. This is going to identify the essential functions for the county government. And some of the departments are very complex. Some of them are less complex, just by their mission and their size. So what we're going to do out of this is we're going to create the core plan, and we're going to create a template that every department can fill out. And if they need assistance, we can talk about that. But what we're going to be able to do is that each department is going to be able to fill out the template and attach it to the main county plan. And we're going to help the county develop the strategy for the continuity of operations, as well as basically create a framework for the whole county to operate in a degraded environment. And when I say degraded environment, that might be cell phones might not work, roads are closed, people are missing. They might just be can't get a hold of them, and you don't know where they are. And some of this is just documenting a lot of what the county departments are already doing that are doing well. They have these plans, but if the commissioner is not available, the deputy commissioner can't get a hold of the deputy commissioner. Where's those mitigation strategies for those essential functions documented somewhere, so somebody else can pick up the ball and run with it?
Can I follow up?
Please.
So once this plan is completed with the Bureau of Emergency Services, the Bureau is going to take that plan and walk to the other departments and say, okay, you're going to fill this out because we need to have this information from you. So this is not going to eliminate the work that the Bureau of Emergency Services has to complete the entire plan. Correct?
No, what we're going to do is we're going to create the plan itself. Each department will be given a template to fill out, and that because they're the experts of their own departments, right? And then that will be incorporated into the main plan.
But it's not taking a load off the Bureau of Emergency Services.
I would hope
because they're still going to have to go out and
we'll help them with that.
And complete every department.
We're happy to work with the departments to help fill out those templates.
So, can I interject here? So, in my opinion, it will significantly reduce the amount of work that the Bureau has to do in order to facilitate getting a complete plan from the county. We can be the collectors of information from each department or each department head and combine that into one plan. What Seamus's company is going to do is provide a plan for the Bureau, the county government in its operations, and then give a template for each department to fill in that information. So as long as the departments cooperate and they give us the information that's requested, it should be fairly easy to put that information together into one cohesive plan.
One second. It's interesting how great minds think alike. You said if they cooperate, because that was a question I had written down. With an external company inquiring as to our departments, that is something that could run into hesitation, right? We have department heads and departments that are defensive of their operations and their positions in any line of business, and especially here. But I've actually turned the coin on this one, listening to some of the great questions here. So initially looking at 20,000 or 25 like was asked last year, so what are we spending this for? Logic would dictate to me that this is just the tip of the iceberg. If I may, Seamus, ask you to extrapolate here, is what's the long-term plan for Putnam County? 20 sounds like the initial, let me get a size up. but if you want a plan, I'm coming back next year with a couple more zeros. Is
No,
that?
absolutely not.
No?
No, we're gonna provide the continuity of operations plan to the county.
For just this amount?
Yeah, yes. And then we're gonna provide templates for all the departments to fill out, and we'll collate that into this is just the continuity plan. This is just the continuity of operations plan for the county. This is not the comprehensive emergency management plan how the county operates in a disaster. That's not that. This is just for county government. This isn't the municipalities. This isn't the public. This is just how the county is going to run its own operations when it's degraded.
Okay, thank you. Order calls for any other legislator that has not been heard from. That being said,
Yeah, just a quick question. You brought up succession planning. Can you go a bit more into that and what that task would entail?
Well, normally we would come up with a series of questions for the county, right? And one of them is, when we're talking, what's the role of the county executive? The county executive, are they going to be the person in charge for the emergency? Right. For instance, again, when I was county emergency manager, county executive was out of the country. He was in the Pacific. He was on a cruise ship when the hurricane hit. So we had to immediately go. The deputy county executive was in charge, and then who's going to be fill the role of deputy county executive?
Survivor.
Yeah. So these are the kind of things that document, and it goes down 2 or 3 layers, right? Sometimes I've not looked at the charter for the county, but sometimes the charter outlines the succession. But we want to go a little deeper than that, right? And within these templates, each department has to identify what's their order of succession. Because people go on vacation, there's emergencies that happen unexpectedly. There's also emergencies happen where you can't get a hold of people. I've seen that quite a bit in my career, where there are people around, you just can't get a hold of them and they can't get to work because, again, the trees are in the road and the cell phones are down. So who's going to be in charge of not only of the county, but of these essential functions?
And just to follow up, see, a lot of that we already have, though. For instance, in Putnam, and I'm sure most, with charters, it spells out, like, for instance, I was deputy county executive, but I had no power. If Bob Bondi, our county executive, was out of the county at the time, the acting county executive, and we all knew that. I mean, and the acting county executive, in that case, was Paul Eldridge. He would take over. Similarly here, if I'm incapacitated, Bill takes over. And our department have deputies and things like that. And we're spending a lot of time on $20,000, I understand that, and every nickel counts. I'm not trying to discount it, but a lot of that we already have as far as succession planning, I would say, but that's just, I'm sorry? I just want to make sure that we're getting the bang for the buck, that's all.
any other legislators?
Mr. Chairman, may I comment? I did ask the same question of Mr. Leary about it being the tip of the iceberg, because I had the same concerns that it was just going to be an observation and a couple of comments, and that we would not get a plan. And I've been assured that we would, in fact, be provided with a plan upon completion of his services. As far as the cooperation of other county departments, they're the only ones that know their department ins and outs and who the right people in the right places should be and have the information needed, not only for the COOP plan, but for our hazard mitigation plan, for all kinds of different plans for the county. So I think it would be irresponsible of any department head to not provide the information that we're asking for emergency preparedness.
Thank you. Right.
Oh, go ahead.
Okay.
Okay, just real quick, what is the time frame for completion of this?
I believe the time frame was 8 weeks, something of that nature.
Just bear with me one second.
And if I can ask while they're looking, while we're, because I am looking at in the backup also, we're talking about the next steps, and that actually is included in the backup. And when we're considering what's the bullet points in the backup for department level, annex development is the next step. COOP training, implementation support, tabletop exercises, design and facilitations, all those bullet points. So are we considering that our staff and our departments can take these next steps on their own? Or are we considering that these optional next steps are going to be optional next year when you guys come back again for another $20,000? to do that.
I'll just answer that. We put that in there just to show, to demonstrate to the county what other services are out there. That's it. There's no agenda of that these are mandatory, required, or anything, just to demonstrate in the proposal that these are the things we can provide.
So I would like to add to that, that the funding for this particular project comes from salary saved by not having a deputy commissioner in place. And as we move forward with a deputy commissioner in place, I think a lot of the things that Legislator Montgomery was speaking of, we can accomplish on our own. We can do tabletops. Once we have adequate staffing, we can conduct training operations and practice exercises without having to hire an independent consultant. But given the circumstances that we're in right now, I feel it's money well spent in order to facilitate getting that plan in place much quicker than we would be able to otherwise.
Sounds like we're giving about $20,000 worth of discussion tonight. Anybody from the public want to weigh in on this particular issue? There being none, I'm gonna.
Just a quick question, if I could.
Chairman Rowe?
It's very rare that we get a fund transfer request before. My question is, we have a vendor here tonight that was invited, and then the request was made. I'm just curious, that I've never seen that before, where the legislature's been asked to move money after apparently a vendor's been chosen. So I'm just curious, how did this vendor come to our attention?
So I met Mr. Leary at a fundraiser through the Deputy County Executive.
Okay.
I knew that the COOP plan was deficient, and the Deputy County Executive told me that Mr. Leary's company offered services of this nature and that we should meet and discuss. So subsequent to that, I had some phone conversations with Mr. Leary. I got to meet him in person, and based on his background and experience, I thought that he could provide us with a very good professional plan.
That's very similar to the answer we received last year. Thank you.
Thank you. Okay, I will make a motion for approval of fund transfer 26T110, Emergency Services Development of Continuity of Operations Plan. Do I have a second?
Second.
I have a second. All in favor?
Aye.
Aye? Motion passes.
Nope.
Motion passes to the full. We don't get to vote.
I didn't vote.
I looked at you, okay.
Okay, and I didn't shake my head yes or no, and I am going to explain my vote, and it's no disrespect to you or your company. You've done great work, and I believe in the work that you've done with FEMA when we get contracted grant money to pay for your services, and I'm just going to leave it there, and it's for political reasons. I'm not going to vote yes. I vote no.
All right, motion carries. Thank you. So I thought you had voted with a nod, but I apologize. Next item, we have item number 9.
Thank you.
Thank you so much.
Thank you.
Thank you.
Item number 9, at first, I will need to make a motion to include additional that was provided tonight, protected additional number 9. And I have a second to add the additional that was given to us this afternoon.
Hold on, I'm sorry.
Okay.
I don't know where we're at on the agenda.
We are number 9?
We're on number 9,
Oh,
and we were given
Yes, that one.
additional that was highlighted.
Okay.
Right at the top here it says, at the request of the Commissioner of Finance, right?
second.
So, all right, we do have a second, all in favor?
The second time that they've changed the,
But I'm gonna look for it.
Okay, so the,
I vote yes.
thank you so much. Right, so the additional has been accepted. Now I'll make a motion for discussion
Go to a
of
fundraiser. Sorry.
item number 9. Discussion co-responder team program transition and future direction. Sheriff Hess and DSS Commissioner Sarah Servadio, who are sitting in front of me. Wow, look at that. What are the odds? Welcome both of you. Thank you. We have additional that was just provided to us today, as happens too often here, last second, to try and take this all in. So I will please afford both of you the opportunity to start the discussion on what we should be knowing about this tonight, if you would please.
I have a statement I'd like to read, if that's okay with the chair.
A prepared statement?
A prepared statement.
I like preparedness.
Let's see about that.
Hey, it's okay. We're all here to
All
talk
right.
about it.
As we discussed during the preparation of the 2026 county budget, I conducted a review of every unit, assignment, and program within the Sheriff's Office to ensure that we are operating with the most effective, efficient, and responsible manner possible. That review included the Sheriff's Office participation in the County Co-Responder Team, commonly referred to as CRT. I want to begin by making something very clear. Mental health related calls are an ongoing crisis, not only here in Putnam County, but across the state and across the country. These calls affect families, strain emergency services, and place real demands on law enforcement, EMS, DSS, and mental health providers. The Sheriff's Office is not stepping away from mental health response. We will continue to respond to calls that concern violence, threats, weapons, criminal activity, scene safety concerns, or any circumstance where law enforcement is necessary. The question before us is not whether mental health services are important. They are. The question is whether assigning a full-time sworn deputy to the current CRT model is the most responsible use of Sheriff's Office resources. The CRT program was originally supported through a federal grant obtained through my prior administration, the Sheriff's Office prior administration. That grant supplied a mental health professionals, training, and related equipment. It did not fund the cost of the deputy sheriff. The Sheriff's Office has absorbed that cost and assigned the deputy full-time to CRT, has meant removing that deputy from patrol operations while still requiring the Sheriff's Office to maintain minimal road staffing. A deputy sheriff, when salary, benefits, training, and equipment and related costs are all included, that represents a cost of approximately $250,000. That number matters because the data does not support continuing this assignment in its current form. From the period of February 5th, 2024, that's when they started this, through May 1st, 2026, about a week ago, Putnam County has experienced approximately 6,479 mental health related calls for service. That's a high number. This means during that same period, CRT responded to 201 calls. That means CRT was involved in approximately 3% of the total countywide mental health call-related volume. Stated another way, CRT was involved in roughly 1 out of every 32 mental health calls. When those numbers are annualized, the county is seeing approximately 2,900 mental health calls per year, and CRT is responding to 90 calls per year. Based on a $250,000 cost of the deputy, that equates to a cost of approximately $2,700 per call. In addition, I spoke to the deputies who are assigned to this because I was curious myself, are they always needed when you go on these calls? Their response to me is we're needed 10 to 15% of the time. Under that estimate, the deputy's law enforcement role is actually needed to 13 or 14 calls per year. That brings the cost to the taxpayer of $18,500 to each CRT call. These numbers are significant. This is not a criticism of mental health. The mental health professionals involved in the program, their work is very valuable. It's not a criticism of the deputies who participate in the program. They serve with professionalism and compassion. This is a question of structure, governance, and operational efficiency. National guidance, which I do have with me if anyone wants to see it, on behavioral health crisis response supports the concept of the right responder at the right time at the right risk level. That same guidance recognizes that law enforcement remains necessary for violence, weapons, criminal activity, imminent danger, or scene safety concerns. That's the model the Sheriff's Office supports. The current CRT structure has also created operational administrative concerns. The program is operating without a fully developed memorandum of understanding, which may be a different circumstance under the prior administration, but I'm talking about this administration here. Without a clearly defined leadership structure and without a unified command framework that clearly establishes authority, accountability, roles, and responsibilities. I think that's what's led to a lot of friction between myself and the DSS commissioners because there is no framework that we're going off of. In this program involving law enforcement, mental health providers, DSS, EMS, and individuals in crisis, that structure is not optional, it's necessary for safety, accountability, and public confidence. In my letter to the county executive, I noted that national best practices for co-responder models emphasize clearly that those defined leadership, unified command, and collaborative oversight are clearly delineated roles and responsibilities. I also explained that from the challenges we are seeing are not caused by the frontline personnel, by those structural and framework policies. Those issues matter. But even we set all those issues aside, the numbers remain the controlling issue. A full-time deputy assigned to CRT is responding to 90 CRT calls per year. That's out of 2,900 calls that the other deputies and police officers are responding to. CRT is involved in 3% of those calls. When you base that on the field experience I got from the deputies, they are needed in 1/5 of 1% of those calls. This is not an efficient use of sworn law enforcement position. As sheriff, I'm responsible for public safety, but I'm also responsible to the taxpayers of Putnam County. I cannot justify assigning a full-time deputy to a specialty program that only reaches a small fraction of the overall need, especially when that same deputy could be better serve the public by being available for patrol, emergency response, municipal support, and the full range of law enforcement duties expected by our residents. I'm almost done. The Sheriff's Office will continue to support mental health response. We will continue to work with DSS, Office of Mental Health, EMS, and county leadership. We are open to helping build a better model that is behavioral health-led, properly governed, and clearly documented, and is supported by law enforcement when safety requires it. But the current CRT model with the full-time deputy assigned to it does not justify the operational return necessary to justify the cost. For those reasons, the Sheriff's Office is hoping to conclude the CRT program at the end of June at the grant period. Thank you. I'm sure you have questions.
Thank you, Sheriff. No, I don't anticipate any questions for anybody, but I would like to, I would like to make something clear for both of you and everybody else to understand that the additional that was accepted, a lot of paperwork in front of us, was the original budget amendment request that was forwarded to the legislature. Speaking of roles and responsibilities, we have responsibilities to say yay or nay to requested budget transfers. So being that our activity or lack thereof previously sort of just put that request in limbo, we have other department heads who have jobs to do. So added tonight to the discussion, although I'm sure it's of no concern to you, but certainly concern to the other legislators here, is that we are bringing up the budgetary amendment 26A22, which is pertaining to this topic, and which is why it sort of got lost in the ethos. That being said, I'd like to welcome Commissioner Sarah Servadio for what I would imagine be a couple of words for us.
I think that our numbers are vastly different from what the mental health worker documents from February of 2024. So I'd be very interested to see how we are so different. So in 2024, our co-responder team responded to approximately 700 individuals. In 2025, approximately 750. In 2026, approximately 240. We've broken it down by geographic location, the amount of mental hygiene orders written, the amount of hospitalizations as a result of those orders, the amount of children, adolescents that they were engaging. So we have much different data sets than the Sheriff's Office, it sounds like. So that should be discussed more, because I can't leave this table with those numbers in your head, because it is my opinion that they are wrong.
Thank you. We'll open the questions from the committee. The chair recognizes.
Is that because my
Seniority.
Oh no, I thought it was my last name.
Legislator Anisio.
Yeah.
is
So
recognized.
how do we come to how do we find out there's this discrepancy?
I can explain where I got my numbers
Okay.
from. These came from the 911 center. These are the CAD calls. These are the calls to 911, or these are the calls to the 7-digit police numbers requesting assistance. Very easy.
So what that doesn't take into account is all the times deputies and officers reach out to the co-responder team directly.
So calls going out and these are calls coming in. basically.
I might disagree with that, because if the SIG call is put into the system, that will be registered in the CAD system.
Whether it's going in or out?
Yeah, because the officers, they should put their jobs into the computer system. So I don't know. I'm not going to say with certainty, but this should represent every single call that came in as a person in crisis, welfare check, child abuse, adult abuse, child endangerment, or co-responder engagement. Those are all those calls documented.
If you don't mind, I'm just going to ask that question. So the 941s and 945s where we have law enforcement involved with those mental health orders. Would that be considered in your account, Sheriff?
It should be if it came through 911, if it came through our computer system, it could have ended up in a 945 or a 941. This is just the calls. Where they end, how they end up, I don't have that documented.
So it seems like we can see where there would be discrepancies. There's a lot of different ways that jobs land on both of their desks.
And they could have calls. I know they do a lot of follow-ups. There's other work they do. I'm not saying they sit around doing nothing all day. I'm saying these are the calls from the public. These are the calls I care about. These are the calls from the public that come in, I need help. This X, Y, and Z is going on. That's where those numbers came from.
Okay, thank you. Chair recognizes Legislator Montgomery.
Sure, I came a little prepared.
I knew you would.
I just want to state that I believe everyone on this legislature recognizes the value of the work performed by the deputies and the mental health professionals involved in the co-responder team. Your work matters, and the people you serve matter, maybe sometimes more. What concerns me tonight is not the frontline personnel. It's not the price tag that matters either, I have to say. It's the apparent decision to end the program. After last year's conversation around the budget season, we were talking about this. It was very clear, and most of us were in the room, and I can say emphatically that every one of the legislators on the board at that time expressed support for continuing this program. And we did express an offer to hire a new deputy. So with that, and I understand the cost of that is $250,000 combined with the $130,000 a year that this program was granted for. I think that's what I estimated. That's a $380,000 a year price tag probably on this program alone. So in prior committee and legislative discussions, legislators from both sides, as I said, expressed support. So we also said, what do we need to do to sustain this program once the grant expires? And I specifically remember expressing willingness to discuss resources, staffing, additional personnel, or equipment. So that's why tonight's discussion for me is kind of frustrating, because at no point during those discussions were we told that legislative inquiries, oversight, or requests for information were creating an environment where the program itself could not continue. The memo that we didn't receive this was CC'd to us from the county executive, states that repeated meetings, legislative inquiries, and oversight created operational challenges and affected morale. But oversight is literally my role as a legislator. That's what I do. Asking questions about staffing, fiscal sustainability, grant continuation, and outcomes is not interfering with any programs. It's the governance that I hope we will continue to do, especially for a program involving public safety, mental health response, and federal grant funding. I can go on about that. That was shocking to me. So me asking questions, I called one meeting in the time of 6 months when we were quite honestly really concerned about the program last December or November, and here we are, it's May, and we got word that the program is being canceled. So that's not insignificant. The county's own data reports that the co-response team has been responding to, is it 70 calls a month? Is that what your data shows?
Mine, yes.
Your data shows differently? So, okay, that's something we have to work out. And if we have to, go, that's not my job to work out human resources issues. We need to go into executive session. I'm happy to do that, but I don't think that's within our purview. I could ask legislative counsel about that, but that's not what we should be doing tonight. So we already asked, I see you did do a comprehensive review, and I understand you got the numbers, and that was my next question, like when did you do that review and how did you come up with those numbers? But honestly, mental health crises are not decreasing. I'm fearful right now that we are impending the possibility of losing services in my town and throughout. We're probably giving up this federal funding right now, $2.1 million earmarked for mental health services, and I haven't seen a budget transfer for the $2.1 million that we're apparently getting that was in a headline somewhere, and there was no discussion. Sorry, I'll bring it back.
Bring it in.
So, I remain willing to discuss this, and I am hopeful with your ideas about continued, maybe looking at different plans and operations, but right now, I don't think that's a time to cancel a plan, a program that we have. We have the funding for it. We can work out these personnel issues. If morale's an issue, I'm sorry, I'm not going to stop asking questions, but I hope tonight's discussion focuses no blame on anybody. I just hope that we are truly committed to maintaining meaningful mental health crisis response services in Putnam County, and I trust you as the sheriff, and I trust you as the Commissioner of Social Services to bring us those ideas. And you know, maybe if the morale is in rough shape with those responding, I understand. It's a really difficult thing that they respond to. I've been there, they've been to my house. It's a really important program, and I will do whatever I can to help you support it.
If I may answer, when it's, I just don't want to forget the questions, right? Because we went for a while. So I'm trying to build up all my answers for you. So when you're ready, I would like to make a couple comments at least.
We did that before. Good, please, go ahead if you want to address those
Just the legislative inquiries. And it wasn't because you requested a meeting. I have no problem meeting with any of you, and I've met with some of you. But you are the fourth legislator to ask me questions about this program.
We're very concerned
That's,
about it.
well, but that makes my ears go up. Why are we concerned? No one called me, had a murder. I had no legislative inquiries. I've had a robbery. Why do people keep asking about CRT? That's what made me dig into the numbers. I didn't even look at the numbers before. When I came and saw you in November, I meant we're going to keep going with this program. But what happened is, every time me and the DSS commissioner disagree on a vehicle or a prisoner cage, the legislators are getting involved. I can't do that as a law enforcement leadership. I can't have this about what cars people are driving. It's just too much. I have real work to do. That made me dig into the numbers. I see the numbers now. I would say, I don't want a deputy. It doesn't make, I need a deputy for the road. Putting a deputy here does not make any sense to me. And you're going to hear from someone, a citizen, who's going to say, we need more deputies in Putt Valley. That I agree with. The numbers don't reflect the need for a law enforcement person to be on all these calls. Maybe take that money and buy more mental health workers. I support that. I agree with you. I think it is a crisis. You saw the numbers just like I did. But these numbers, the way they stand, it's a hard time me saying, giving a cop saying, you're just going to be a bodyguard and we're going to need you 0.5% of the time. I have much higher needs in law enforcement than that. I'm just being honest with you. I understand the concern. We're there if you need us. If there's a police function, we will send a police officer. I want more police officers on the street so we can instantly respond to these crises. But I can't have somebody just sitting around, I don't want to say sitting around, because they do a lot of work, and I don't want to take anything away from them. There's a lot of follow-ups, there's a lot of continuing things, but I don't think law enforcement is needed there. I think mental health workers, and this is my very low-level opinion, right? I'm a police officer. That's what I do. I don't understand mental health. It's not my wheelhouse. I understand data.
Okay, but
That's what
I
I'm
understand
with.
people, and if I may, through the chair, and I'm sorry, I need the mental health workers to go into a call like that, because mental health situations escalate into very dangerous situations.
My guys are doing it 6,000 times in the last 2 years. You don't have to explain it to me. I agree with you.
Okay, so can I just, the budget, we never resolved the budget transfer, and if I could just speak to that. So, involved with this grant was the lease of a vehicle, that we're now using the remaining funds of the grant to purchase the vehicle.
Correct.
And the vehicle's gonna remain with the sheriff's department. And I have a mental health department that has one vehicle, of 5 workers.
That's not true.
And one vehicle.
It's a county vehicle. It will return to John Tully wherever he decides to put it. If it stays on my fleet number is locked at 103.
Okay.
If it stays at 103, it doesn't matter if I have the Jeep. That does not matter to me at all. We had to take the equipment out of it. We had the lights and sirens and all the police equipment. So it kind of made sense to leave it, honestly, with me. I thought financially, and get her a new vehicle if that's what they need in mental health. But I have no lock into the vehicle.
I'd
and
love
it
to see a
really doesn't
deputy in that
concern me.
vehicle.
That's fine. Yeah, we'll take the stuff out and
For
anyone
this
can have the
program.
vehicle.
Okay, you can move on.
Thank you so much. All right, Chair recognizes Legislator Birmingham.
Yeah, I've said this to the sheriff before, when it comes to law enforcement matters, I defer to you because I'm not a law enforcement professional at all. I'm a legislator. But similarly, when it comes to social services and mental health resources and opinions, I defer to our commissioner. Because again, I don't do what she does. I'm certainly not schooled and technically proficient in anything you guys do 24 hours a day. But what I do get the sense of, and I think we're all in agreement, and I think I can speak for the 9 of us on this, we don't want to see this program end. We think it's doing a lot of good work. And, you know, we hear about mental health issues. I think, Sheriff, correct me if I'm wrong, you even said at one point, you were thinking of, if I'm speaking in terms of BCI into narcotics, you were going to do.
We're combining, right, we've moved some, like everything we have at the Sheriff's Office, we're reviewing it, seeing where there's efficiencies, seeing where I think there's inefficiencies, and moving personnel around to kind of handle that.
Narcotics maybe to put somewhere else.
Correct.
So my point is, I'd love to see this program survive in some manner. And we do have 4 other police agencies in Putnam County, 2 in a village, Cold Spring and Brewster, and then the town of Kent and the town of Carmel. Again, I'm not a law enforcement professional, but I do know about intermunicipal agreements. We can do IMAs. Now, the next question would be, well, what about the town of Putnam Valley? What about the town of Southeast that Tommy and I represent? I represent the village of Brewster. And it's a rhetorical question at this point because I don't want to be unfair and ask anybody this if they know the answer. But I do know out of experience that the village police cars in Brewster can make certain police activities outside of the village of Brewster. I don't know if they... Certain amount of mileage.
If it's a felony misdemeanor, you can go outside your geographical area jurisdiction.
So I'm wondering if there's any way, and again, the only, and again, I'm not gonna, we can't force this on you. You are the elected sheriff. And that, I'm not looking to do that.
I'm just looking to do what's right for everyone in the county.
But
there might be different models, right? We could look at what Danbury, Connecticut does. They have mental health workers that go out with patrol. I think a lot of the problems with this program, and I don't want to say problems, that might be the wrong word. Challenges, thank you, is day tours on Monday through Friday. That's when we have mental health workers, we have hospitals, everyone's around. What I notice, and this is non-scientific, is it happens on the evening tours. That's when I hear most of the mental health calls going out. That's when we don't have them, right? Maybe this worker will go out with them on the evening tours. I'm open to other things. I just think having a dedicated deputy assigned to this does not make sense. If we want to look at different ways of doing it, I'm open to having any discussion you want. Just to throw that out there. I'm not saying you're wrong. I'm just saying I think we got to look at the model.
And I'll wrap it up with just to the chair and a suggestion to the committee. Yeah, sorry, I'm a bit long-winded. Maybe this money can be dedicated to a group intermunicipal agreement. Keep the car, and maybe, again, if we were, and again, I can't speak for the newer folks, but I know a lot of us last year were prepared to put money in the budget for an additional deputy, and again, we can't force that on the sheriff, but maybe work that into an IMA so that there's more money to again, take care of this good service. And I'll leave it at that. That's just a thought.
I think the only thing that would be even close to appropriate, that would be the New York State Police would have the overlapping coverage that the Sheriff's Department provides. All the other ones would have big holes in it, but the chair will now recognize Legislative Counsel with the
Through the chair. I think if I'm hearing the question and challenge posed correctly, what I'm hearing is that the sheriff is pointing out that he does not want to devote a full-time patrol deputy to calls that are not, law enforcement in nature, that where it is primarily a mental health crisis and there is not a safety or criminal issue there. So I think that what I heard the sheriff propose was alternatively, in order to make sure that 100% of that assigned deputy's time is devoted to criminal matters, that the mental health professional would join the patrol matter, so therefore the deputy who is going out on patrol already would have a mental health person. And there actually may be things that are falling through the cracks that are related to mental health crises that occur in the day-to-day occurrence on a patrol call that are being missed because the focus has been emphasizing on bringing the patrol to mental health rather than the mental health to patrol. So I think that it would make more sense to have a mental health professional on hand to assist when needed in patrol, as opposed to having a deputy sort of taken off the road waiting for a mental health related call. It just seems that perhaps if the lead on the calls was placed back with patrol, it would make more sense to ensure that that deputy was able to be responsive as needed to emergencies.
Thank you. Any other legislators? Since it appears council is running for office next year.
I just want to say.
Go.
I'm sorry.
No, that's right. Sorry.
I just wanted, I know,
And
okay.
then Aaron, and then Bill. Okay.
I just wanted to read from our sheriff. He states here that I am open to exploring alternative models that may be a better fit for Putnam County, including mobile crisis team structures in which behavioral health professionals respond as the primary resource with law enforcement available as backup when public safety requires it. So this was what you wrote, I'm just stating.
That's how we did it when I was in Westchester.
And that's, yeah.
Oh, it's better to lose that word.
I'm just saying.
Chair recognizes Legislator Crowley.
Thank you, Chairman. So years back, I think some of us, Tommy, I don't think you were around yet, and Jake and Laura, years back, I don't even think I was, they were proposing to do a mobile health unit with iPads. I believe that was something that was proposed, and there was some sort of hiccup that it never came to fruition, correct me if I'm wrong.
Yeah, it was a grant that the prior commissioner received and iPads were purchased.
They were purchased, so whatever happened with
There
that
was
program?
no staffing available
So no staffing available?
on the mental health side.
Okay, so we had that went through, and so we still have the iPads, obviously they're probably
Outdated.
very outdated, so that was through a grant. I support this CRT. I use it a lot with my other job. It's a nice thing to have because when you have a person in crisis, you can talk to a worker and they can identify. You get the same people every year. You can kind of tell when they're off their meds and things are happening and they may need a welfare check. So I call a couple times a year, probably 10, maybe 12. So I support this, but I do think that I would like to see a mobile crisis team also too, of some sort, because we were supposed to get that years ago and it just never happened, and they have it in Westchester. We have nothing for adolescents here, and that's been a big complaint of mine for many years. Putnam Hospital doesn't service them, New York Presbyterian is changing insurances with a lot of the people that we have here. So I do think we need some sort of something to address our adolescents that isn't so, I'm married to a cop, so I can't really say that they're aggressive, but I guess I can. But, it's not so aggressive all the time,
So our mobile crisis team does work with the adolescent population.
But that's what I'm saying, is there needs to be something, whether it's mobile crisis or something, and it's kind of run out of like a Westchester style, or there's gotta be something there to replace this if it's not this.
So I do think that these are all questions and options that could have been discussed if the comprehensive review included the commissioner of the department. So Sheriff Hess and I could have had these conversations and come up with a plan. If this is not how the sheriff's office wants to move forward, then we should have had conversations about that prior to right now, and we didn't. So I question the comprehensive review because it was not comprehensive to include both parties. So we will address
I have confidence.
the issues.
Legislator Crowley, any other questions, or can I go to Bill?
No,
Okay.
thank you, Chairman.
All right. The chair recognizes Legislator Bill Goodwin.
Does there have to be a deputy? Could it be an SRO type of individual?
Deputy.
SRO's a deputy.
It's cheaper though.
No, SPO you're thinking, but no. It is cheaper. I don't know who you're going to get to do that because they only work so many hours a week because of their restrictions. They're restricted to $35,000 a year.
Yeah.
But I would just say, the example, Legislator Crowley just gave, none of those sounded like violence, police-related calls to me. You need CRT. You don't need CRT. We're calling CRT as a police officer and mental health person responding. You don't need a police officer, those. You don't need a police officer if someone's having a mental health. You need mental health people. That's our difference of opinion.
Yes.
That we can go with that.
And they so escalate so quickly.
Yeah, if I may.
Sorry.
Sometimes the
Chair.
presence of a police officer prevents a situation from escalating.
Sometimes.
It becomes an incident. Chair recognizes.
Sometimes that makes it worse.
Right? Hopefully not in our county. Chair recognizes Legislator Sage.
Thank you, Chairman. I'm looking at 6,400 for give or take mental health calls. And I really appreciate the job that our deputies are doing out there because I'm sure they see a ton of this. I think the CRT team for mental health is meant to support these calls and to maybe facilitate a smoother...
And they've done a great job at that, right? The CRT team does the follow-ups from the night before, but do I need the police officer to go on the follow-ups? Right, that's really the crux of this. I agree with you 100%, we need mental health workers. Do we need a $250,000 police officer where I'm short on the road to go with the mental health worker?
Is that
And my argument is no.
Yeah, and you also talked about most of the calls are at night. I mean, I'm just sad, a little sad.
I would like to that's see that unscientific, that's my...
But I would
go back
mention
and
it probably would be.
Somewhere in there,
I'm just a little sad thinking about the stabilization center. That would be a resource for our officers to be able to bring somebody in crisis to
We did take a look at the times of calls for people in crisis prior to setting up the schedule of when the team would be working. So out of the snapshot in time that we looked at, it was best to do it during the day tour and also to assist the other police agencies.
And she could be right. I can't argue with that. I said this was unscientific, just me listening to the radio.
And I
Is there a
just
plan I think, as Legislator Birmingham stated, I think we're all in favor of the CRT team continuing. Is there a way that it can continue? Is there any path forward that we can work on? Because I think there is an appetite for that, and it might be something that the commissioner can maybe come up with a plan with maybe the $2.1 million of the ARPA funds or county funds.
So I think the first deputy on the team was trained and experienced. So I think that if we are able to take even an SPO or two that has background and or we can train them, we can't just throw, and Sheriff Hess might disagree with me on this, you cannot just put any deputy on the team and expect it to go well. So you need training and you need to have some experience working and engaging and de-escalating people in crisis. So we would be certainly open to having a conversation about an SPO or two doing that. And we have talked about pivoting the team in different ways, but unfortunately we have not discussed that. This is the first time we're doing that.
Thank you. I will take this opportunity to specifically thank both of you for showing up here tonight and facing all of these questions. There's a great level of concern. There are fans galore of 9 people staring at both of you right now, big fans of both of you. And everybody has opinions on this topic, and we want to thank you both for showing up here today and answering this question. It is a discussion item, so are there any questions from the audience now that every person's been heard from?
And can we mention the budget transfer? We have till June 30th to use it. I would like to use those transfers to make sure we use that money.
That sounds like it makes sense. I have at least one public comment coming, so can I have legal counsel? Are we time limited with that?
Yeah.
This transfer has to be executed in a timely manner?
Yes.
Okay. Does executing it sign the death certificate of the CRT team?
I mean,
It's already
anything
been
can be
signed on.
revisited, there's no, I mean, I wouldn't call it a death certificate, you can revisit any program at any time, I mean, you
Okay.
have that capability.
Okay, so we're still in section 9. I'll recognize the member for the public. If you'd come up to the podium, please.
Yes.
Identify yourself and what town you come from.
Jonathan Cummings, I'm from Putnam Valley.
Welcome.
I'm here for unrelated, but seeing that this issue has come up. I have an extensive background in emergency services as employment and as a resident, and I can tell you that from my experience that I understand, I have family members that have mental health issues, that most of the things that I believe the sheriff is speaking about and the commissioner of DSS is speaking about could be alleviated, right, by proper call taking. So in the event that someone calls 911, right, I mean, the commissioner of BOES is here, he could probably answer my question. There are specifics in the CAD system, right? If I call up the CAD system, and it's happened to me personally, I had a conversation with Bob Lipton about it, if I call the CAD system and say that there is a tree on wires, okay, on the primary wires, I'm aware of this, I'm a fireman, been doing it for 32 years, there's nothing in the CAD system for it. I was specifically told that there's nothing in it. You have to call NICIG yourself. That was what I was told. I said,
we get texts that say that. You and I get texts that say that.
it was a tree on the wires, but irrelevant. So now I'm a parent, right? My child is having a issue, or my young adult who has a history of mental illness has an issue. I call 911. There may be a limit to what they can put in the CAD. They can't just call, hey, Baker, Charlie, you know, the various sectors and say, hey, listen, and the sheriff could correct me if I'm wrong, and so could Commissioner Osler. There is a limitation to what can be input. So if I call up and say that my schizophrenic child has a knife, is in their room, there's something to say it. But if my child is distraught about something, okay, it has to be coded a certain way. Now, those are two different things that would require two very different responses, and everybody here can agree to that, okay? So I agree with I agree that the sheriff, because that's why I'm here, is for an increased police or increased manning, right? But that's a different issue that's later on. Yeah. So if we could have it that the commissioner of DOES, the sheriff, and the commissioner of social services comes up with, well, let's figure out when it's needed. That way, that deputy that is full-time assigned doesn't need to go to the 16-year-old kid that's depressed about breaking up with their boyfriend, okay? But is required to go to, hey, my son has threatened me with violence, all right? That is something. That's not something that, those two calls do not require the presence of a police officer. They do not. But in these many cases, that's probably what's happening. I mean, I listen to the radio too, just like the sheriff does, just like Commissioner Osler does. I hear everything that goes through.
Right.
So that is something that should be considered. You know, we need more cops on the road, and that's why I came to speak to about later on.
Thank you so much. No, we need public comment, okay. Any other public comment? Okay, so then we have in front of us the budgetary amendment, which has been added to the agenda for tonight, of 26A022, the revised edition, which has been added as an additional tonight. Make a motion to accept this budgetary amendment. Do I have a second?
Second.
Second it. All in favor?
Aye.
Motion passes. Budgetary amendment 26A022 is passed. Thank you for everybody being here and all of the input on that. Next up on our agenda tonight is something called other business. Make a motion to accept the additional other business which was handed us tonight. Get a second?
The entire program.
You get a second?
Second.
I get a second on accepting other business. Okay. In front of us we have. Sorry, sir?
If I could, this is the topic that.
Yes.
Could I just?
Oh, I'm sorry.
Yeah,
Yes,
yeah.
Dan. Yes.
Thank you. Thank you.
Sheriff, my colleague needs a ride home.
No, I'm good. I'm good. Thank you. My colleagues know what I'm gonna. I'm sorry?
Oh, no, I said I need sugar. Sorry.
Okay, sorry. My colleagues know what I'm going to say, but I think it's more important that the people who've been sitting here for 3 hours hear what I have to say. I'm obviously a legislator, but in my daytime job, I'm also an attorney. And my law firm, in a very narrow way, represents the village of Cold Spring as bond counsel. And it's my understanding that, and I really haven't delved into this topic too much because of what I'm about to say, I understand that there's been an initiation from that village for some purpose tonight, or from somebody from there. So out of an abundance of caution, I'm not going to participate in tonight's conversation nor vote on it when it comes to the floor. And as more of abundance of caution, I'm not even going to be here in the room when it is discussed. Just for, conflict issues and things like that. Again, my firm doesn't have anything to do with this, but I didn't want to just get up and leave after you guys have been sitting here for 3 hours and think that I didn't want to hear what you had to say. I just want to let you know that that's why I'm leaving. And I've recused myself a couple of times in the past for different things, so this is along those things. So I didn't want you guys to think I wasn't appreciating you. We're paid to be here. I know that. You guys are taking time out of your day, so that's the reason why I'm going to get up and leave. So I just ask for your understanding on that. Thank you. Thank you, Mr. Chair.
Thank you.
You're going to cash that penny an hour check?
Okay, so item number 10. Tonight we have an agenda item of other business entitled The Discussion, a Letter of Necessity, County Participation in Article 78 and SEQRA Declaratory Judgment Action. This item came to us from the County Executive requesting that Putnam County join the town of Phillipstown and the village of Cold Spring in their Article 78 and SEQRA litigation related to the Hudson Highlands Fjord Trails FEIS. In the memorandum that was sent to us, the county executive states the county should join the town of Phillipstown and the village of Cold Spring as a petitioner in the matter. Before proceeding, I want to note for the record, before proceeding, I want to note for the record that although the legislature has been asked to consider county participation in litigation involving a potential taxpayer expense and legal exposure, this committee has not been provided with any of the proposed Article 78 draft petition, any underlying pleadings. We have not seen or read the expansive final environmental impact statement for itself, for which this lawsuit is based on. We don't have any cost estimates. We don't have any litigation documentation for us to review. Having only received this request from the county 2 days ago and missing the relevant documentation, and considering that we received a letter of necessity after our agenda has been published, the public has been short notice on the potential action. As chair of this committee, I sought out preliminary guidance from our law department. Correspondence received back from law dated May 12, 2026 has instructed me and us in the committee here, at this time, no guidance as to litigation can be provided, as we do not possess either legal documents or case documentation. The law department, the county attorney, further recommends the committee consult with legislative counsel. So given the complexity of this matter and the absence of the underlying documentation and the lack of notification to weigh in a meaningful way, with the advice of the county law department, I would like to entertain a motion and move to refer this matter to legislative counsel for legal review and analysis prior to further committee consideration. Can I get a second?
Second.
A second, okay. So now we can have discussion on the motion as been seconded. I gotta say this, I wanna make this clear, the motion on the floor is limited solely to whether or not we're going to refer this to council for further review. Debate has gotta be refrained and confined to procedural question and not the broader merits of the Fjord Trail project or the proposed litigation itself. That being said, hopefully set the parameters and the bumpers like we did with our other discussion. I recognize the committee for any discussion at this point. Anyone? Anything?
No, I mean, I've been aware of this project. I have a packet here with a memo from the county executive, a memo from the supervisor, a letter from the supervisor, a letter from the mayor. And the resolutions that the mayor and the village trustees passed. And correspondence from the Bureau and correspondence from the sheriff, the Bureau chief is here. So I don't have an Article 78, I don't have an FEIS. I find it would be wonderful if you have read the FEIS, because that is the document that you're being asked to sue for. So that's my comment. I don't have that material in front of me at all.
I think I want an attorney to read it.
Yeah. Well, I am one on TV.
Okay, cool. Anything from legislator Adenuzio?
Did you read the law department, the letter that we got? I'm just looking for it now.
The one
It's
that
on
we
the
just.
last page.
Yep.
From Compton.
The response?
County attorney.
Yep, asking for.
Did you read that?
Yep.
You can read
Well,
it.
read it
No,
aloud.
into the record.
Okay.
Tony can read it. Or...
Yeah, if would you mind? If
Okay. This is dated May 11th, the county executive, today at 1:45. Okay, this is correspondence communicating his support for the county of Adjournment. You said that as chairman of Protective Services, I respectfully request that you, or representative from the county.
Sorry to
Is this
interrupt
the right
you.
one?
You're reading
Am
my
I
letter
reading-
to
I'm reading
Compton
yours.
Spirit.
Where's Compton Spirit?
That would be next. To Thomas Regan from
Okay.
Compton Spirit.
This is to acknowledge receipt of the memorandum dated May 11th, 2026, relative to the Ford Trail. At this time, no guidance as to litigation can be provided, as we do not possess either legal documents or case documentation. At this point, it is recommended the committee consult with legislative counsel. Thereafter, should the committee or the legislature desire a more comprehensive evaluation, I have determined independent arm's length outside counsel will be retained to provide same. Thank you for your understanding. And that is from Compton County, our county attorney.
Our county attorney. Okay. So he has not given a recommendation, but given us a warning this is going to cost money. Is how I read that. Okay.
How much?
Doesn't say, so we don't know. Recognizing any other legislators? Legislator Crowley.
Would you be adverse to reading or I can read, it's up to you, the letter from the sheriff and BES regarding this?
I'm going to say no, in as much as the question on the floor is, do we refer this to council? And that's not necessarily germane. All, like the correspondence that we have here, which are emails back and forth, and some opinion letters, don't go to the core issue about what we are going to do, which is, are we referring to council with this motion?
Okay, with that being said, I would respectfully ask, though, that you indulge in the people that have been sitting here for several hours about this at the very least.
The problem with that, though, is that takes us exactly off course and brings us into a presentation either in favor of or against the trail, which is not under the purview of the legislature.
I understand, but public comment is something that we put in our legislative manual, and that is something that should be.
Can we let the chairman do his job and let
I
him
didn't
open
ask
it
you,
up to
Nancy, I was
legislators?
talking to Chairman
There's a
Regan.
motion on the floor to refer
You're not the
this to
chair.
legislative
Point of
council.
order.
So if public has comments about that, they can speak to that, certainly.
Point of order.
Sorry, Chair.
Okay.
If the public has
Just
comments
Okay,
about chairs,
okay, everybody got their 2 cents in,
Okay.
right? Trying to keep it in the bumpers here.
speak to the motion.
We have somebody standing at the podium. First, I'm sorry, Cindy, before I get there, any other legislatures have input pertaining to referring to council with the motion? Seeing none, I recognize Cindy Tribble up there. If you are hopefully within the lanes of what's in front of us, please.
I believe so, Chairman.
Okay.
I'm not going to speak to the facts, whether the Fjord Trail should go through or shouldn't, or we should sign on or not sign on to the legislation, but I do have a matter that I do think speaks to the heart of this and is important. I want to raise a fundamental issue of representation, accountability, and integrity regarding the Hudson Highlands Fjord Trail. Bear with me. Under the New York State Environmental Quality Review Act, I understand that the county legislator is not the lead agency. But that does not remove the responsibility of elected officials, especially a district legislator, to engage when a project of this magnitude directly impacts their constituents. The Village of Cold Spring Board of Trustees, the municipality most affected, took the extraordinary step of unanimously identifying and taking legal steps to address the deficiencies in the final generic environmental impact statement issued by the New York State Office of Parks, Recreation and Historic Preservation. Those deficiencies are not minor. They include traffic, parking, infrastructure, strain, public safety, and consistency with local land use controls. These are core issues that go directly to the quality of life and community sustainability. It only takes, well, I'm going to skip all that because that goes to the heart of, what the problems. Despite all the problems that we have been experiencing with this issue, regardless of what side you're on or not, our legislator, Nancy Montgomery, has not publicly addressed these concerns. When a legislator has a documented history of participating in and expressing enthusiasm for a project, but does not engage with its identified risks or deficiencies.
Cindy, I'm sorry, you're putting me in a position, I'm gonna have to call to order here that you're varying from the topic at hand.
No, I'm not, I'm calling for her to recuse herself. Because she is very much in support of something that you are getting ready to review as to whether you should take it up. Just like legislator Birmingham recused himself, Nancy Montgomery should too. The village of Cold Spring has unanimously voted to file an Article 78. The town of Phillipstown has 4-1 voted to file an Article 78. The one dissenting was about cost, not about the facts.
I can recuse myself, you guys can vote.
Yes, I would appreciate it if you would, because you are not, if you are representing the constituents of District 1 in Phillipstown, how can you not be standing at a mountaintop screaming about what they're unanimously alleging?
I've read
I'm not finished. I'm not finished.
I've read the FEIS.
Okay,
I
and
can
you,
tell you what page
and you're
number
running
and addresses
contrary
emergency
to our
services.
village and our
Folks,
town.
I have to
So
call to
therefore,
order.
you should
I gotta call
You know what, I'm not gonna
here.
recuse myself.
You should recuse
What law
yourself.
says I have to recuse myself?
Well, you should.
Cut that out.
You should.
What law says I have to recuse myself?
There is no law that
I
says it.
represent
But
the
you're
majority of people.
There's a
in
conflict of
Phillipstown.
Call the meeting
interest,
back
and
to
you're
order
giving an
to
appearance of
refocus the
impropriety.
question.
You should recuse yourself, because if you want to be ethical and not give any appearances of any conflict or impropriety, you would recuse
Does
yourself.
the mayor recuse yourself
Cindy,
from
you've afforded
advertising
the
about the
opportunity to
Marathon
convey
Battery
your feelings, thank
project?
you.
Does the mayor recuse
We-
herself from
We're
advertising?
not talking about the mayor, we're talking about you,
No, but you're
on your
saying-
right to sit on
Let's
this
say you're starting
committee.
cross
The mayor advertises
You're
the
starting
Marathon
cross
Battery
talk.
project.
Please.
This is not about,
Yes, we think
she's
it's-
deviating from your
And she makes a
Your
vote on it.
chair-
You're making the situation worse. Come on,
we're not.
You were afforded the opportunity to make your point, and it was.
My
well
point
conveyed.
is, you have a conflict of interest, in my opinion, on your committee, and she should recuse herself. She's representing a district
Cindy, you made that,
both the
listen, you made
village
that point very
and the
well.
town.
Very clear. Very clear. You've made that point. You've
Okay.
conveyed those points.
Okay.
It's very clear your position on that. I will reply myself to you, is that the motion here is not approval or disapproval of the project. What has to be said emphatically, that we get into loud points, is that this landed on our desk
Right.
48 to 72 hours ago.
Right.
48 hours ago, okay? Which has now put us in a real hot seat here, right? We have constituents who have concerns on both sides of this. We want to do right by everybody. But put in a position here where there is no right answer. The only right answer is coming up with a hand over there, legal counsel. Because regardless of my feelings on the topic, it would be ill-advised in any circumstance for just learning about something and say, we're going to throw in the county and we're going to go in with this lawsuit and see where it goes.
No, and I agree with you, Chairman. I don't disagree with that, and that is not what I'm raising here tonight. I'm raising a potential conflict of interest and an appearance that we have a village and a town that has basically voted unanimously on one way, and we have a county legislator
Cindy.
that's
And-
advocating on another way.
Okay,
She
you-
should recuse herself.
You've made that point emphatically, it's very clear. Please, let me, yes. I recognize legislative counsel, please.
Through the chair, first of all, a difference of opinion is not a conflict of interest, number one. Number two, we have been asked to discern whether or not to involve the county in the time and expense of litigation, yet have been provided with no actual source document as to the nature of the project, the nature of the litigation. There's been no affidavit, no provision of anything. What we've been provided is a pile of rhetoric. okay, on both sides of this issue. So if I am going to be asked, just like the county attorney is unable to assess anything to do with this litigation based upon rhetoric, nor could I, nor could anyone, nor could any attorney, because you actually need actual source documentation to review to determine the legal propriety or impropriety of a legal action. Okay, so while I understand there are passionate feelings on every side of this, and I fully appreciate the autonomy of the town to vote in any way that they see is best in the best interest of their constituents, respectfully, in order for the county to determine what's in the best interest of our constituents and the elected officials who are all charged with making this determination, I believe that we are entitled to source documentation so that we know we're making the right decision for the county and the taxpayers. And respectfully, there was a motion on the floor, and all that was really needed at that point was a roll call vote with respect to that. You can call the question.
I did, thank you, I acknowledge that, but did want to afford the opportunity, right, of my committee members as well as the other legislators, and recognize that some people have come here, and I apologize, but I can tell you this much, is that we were just given this and asked to enter into a lawsuit, which is why I'm going to do exactly what council is calling for right now, having already gone through the room one time and asking for my colleagues, seeing no other hands. I will call the question on the referral to the Law Department and ask for a roll call vote, please.
Legislator Adenizio?
Yes.
Legislator Montgomery?
No.
Chairman Regan?
Yes.
Motion carries.
Motion carries. Item has been referred to legal for further investigation.
Could I just mention the timeline that we're up against? Because we need to file by May 19th, I believe.
That's not our problem.
And may I just
That's
mention
not our problem.
that,
We'll go on our own, no problem.
I'm gonna be honest.
and may I just mention that the difference of opinion, and I agree on most of everything you said. She just said she's in an oversight role, she's in a regulatory role, that's different than just a minor difference of opinion.
So that we can all speak
She just
freely.
said, I'm in an oversight role.
understand
You're
what
not
you're saying.
supposed to be on one side or the other when you're in, she's supposed to be in a
It's a
position
no,
of.
but the motion carried off of 2 other.
Calling order to the room, I need a second for a motion of adjournment to conclude this meeting.
Second. I'd like to comment that.
All in favor? Aye, motion carries. Meeting is adjourned.
Very hard to decide how to